exactly the group, the nature of the group, and the people of the group, and we know how far we can move. This course is very different from just giving lectures.
Sorry, that has been there. There's people that are wanting to see it.
So often we find that we have an agenda when they see the group of people and also we just want to see the pace of the first day, and it's, I guess, for this first hour, I always wanted to get feedback from you, and also it is so important that we learn from one another. If you just want the lecture, you could read it, you can read articles, but it is the opportunity of learning from each other, and this is what the course was structured for. Okay, I feel very unnatural to be so far away from you, so I'm a little bit self-conscious. And you know, two of the important topics in the registration is self-disclosure, and what else? How do you manage transference and counter-transference? And so I thought, yesterday you spent quite a bit of time talking about self-disclosure. And I just wanted to have some feedback, some interaction, and also share some experiences that you have had. I have asked Steve not to tape because we just wanted you to feel free. And the reason we are doing this is so that the 3 people doing online can participate. Is that okay? So just feel free to react and interact and tell us what you learned from lecture yesterday about self-disclosure, how important it is, and have you done so? And what have it been successful in your experiences? And in some areas you say, that was a disaster. Okay, share it. And then we can. Would that be okay with you? Good. So I thought we'll spend an hour just talking about sharing our experience in self-disclosure. What is self-disclosure? Anybody want to give me a definition? I'll tell you a story. One of my graduate students, for the first, almost in the on-site placement, the first 3 months, she didn't say anything. And I was not her supervisor. So she came to me, she said, I've got a problem. Could you help me? I have not been supervised. And I said, well, you've been placed, yes. But I have not been supervised. So what's happening was, she was the practicum student placed on site working with clients. And at the end of the session, usually you go to your supervisor and you debrief and you move on for the next session. But every time during supervision, the supervisor was so, I guess, not really centered. And she used our student as someone she would talk to about her own experiences, going through her own stuff. She said, I'm not getting any supervision. And I became her counselor. I mean, those things do happen. And sometimes now that's overdone because you want to express your own, something triggered, and you say, I have such and such. So what are the limits? What kind of sharing is okay? What kind of disclosure is not okay? And how do you judge? Now, you are all experienced psychotherapists, counselors, and professionals. Give me some feedback, what your experiences are, and what is the function of this self-disclosure? Yes, please.
For me and my colleagues here, we work within an organization, and so we have to kind of balance the tension between our philosophical and, driving motivators for the work we do in counseling in a college with the priorities of the organization itself, which dictates how we do our practice. So the limitations of that I struggle with, because we're expected to see everybody and everything. So, I'm expected to work outside of my expertise for a certain period of time until I push. Did you say we have to push? To say, no, this is, not within my area. A good example of that was I really struggled personally and professionally when I was expected to work with a group of autistic students. It really, really threw me. And having no supervision. And the other piece that was an aha moment for me was around cultural issues. I was with a young Asian student, and I happened to have an Asian colleague with me. And they were talking about some things, and I completely missed the importance. They were talking about dreams, and I completely missed the importance of that piece for the student until my colleague said, culturally, that is a huge piece for this young woman. And I completely missed it. It was like, oh, I need to be talking more about these kinds of things.
You have brought up two very important. We always practice within our competencies. And we could say, well, that is something that I don't really know, but I can learn about it. Or I could get somebody who is familiar with this. And this is ethical issue. I cannot practice outside my competence. But that makes that we could learn more, right? If that is your interest. But at the moment, I'm not. And second issue is the cross-cultural issue. And this afternoon, it's a huge issue, especially Toronto becomes very diverse, and we are multicultural in all cities now. And we really need to have the knowledge of multiculturalism. And so this afternoon, we're going to start on the how to use the cultural self. What do we mean by cultural self and multicultural self? So we're going to explore that area this afternoon, but we will continue next weekend because it's impossible to cover within an hour and a half. And that's unrealistic. So what is self-disclosure? How much you open up and what kind of material can you disclose? Could I have my slide on, please? And why do we disclose? What is the function? What are the functions?
Sometimes to make the client more comfortable and be able to open and trust.
Okay. Is to build trust.
Yes.
Right. And it's build relationship.
Yes.
Right.
I use it so that they realize that I understand what you're saying. The way I'm saying, I got it.
Good.
But it only to help, just to make the point just to make a point then that I understand.
All right. Good.
For me, I think,
Louder. I have to be so far away.
Oh, that's okay. Okay, so I do some grief counseling as part of my job, and my husband died some years ago, and so I'm always always thinking through when I'm working with clients that are experiencing grief in terms of when share that I might not do. I think for me, the guiding principle is it should not be about me and the fact that I want to talk about that. It's more to make a connection, and I rarely bring it up, and mostly because clients raise, they'll ask a direct question like, have you ever lost anyone before? Or I see where they're stuck, and they can't, because they've shared that, well, people can't resonate unless they can't get it. Sometimes I'll just bring it up right then and just move on to, I get it. I know our experiences are different, but I've been there, kind of thing, and that kind of like opens them up a little bit more, and we just move from there. But
what would you do if during counseling and your client said something that triggered your soft spot? For example, you talk about grief, and all of a sudden the setting and the mood, and it triggers your emotion. What would you do?
In this specific relation, well, I think it's probably difficult for me to go back there because I took a lot of time to work through my own husband's passing, so it's not a natural thing for it to trigger me because of the amount of work I've done over time with that. So it's just, to me, it's just a matter of resonating with them rather than it taking me down the path. It doesn't, not it.
And that is one good example to say that if you have issues, you have to deal with that personally. So that when you have clients that will trigger those areas, then you're already dealt with. Now that is easy said than done.
Yeah. Because I remember one time I was working with this client, and they actually started to go down that road with me. So how did you do that? And I had to just like, this is your session. It's not about me. So we kind of just redirected them back to where. Well, that's what I did in that setting. Because I didn't feel.
If I were the client and I said, I want to hear how you dealt with that.
Well, I remember once, and I actually had to talk about it after, because I remember one, not recently, but before, where I said, well, this helped me going to therapy, helped to having, something that I used to memorializing, that helped, and just having just a good supportive network helped, and then kind of just went back to them,
Right.
So.
Right. Any other?
We can use
Yes.
bracketing skills. It's a process that I learned through psychodrama. It's basically when something mirrors, our clients mirror issues sometimes, is to really getting into the habit of something goes on and say, okay, and put it on the wall and I'll deal with it later. I have to be present for the client. But as a primary modality of feminist therapy, we do make disclosures as a way of saying that the experience of violence is not the experience of just you, to normalize and also to build some connectedness in some of the sentiments that have been expressed in terms of I've been there, I understand, though I qualify it. Our experiences are different based on who we are and who does what to whom. So where there's common discharges, emotional impact, etc., the more social identities are implicated, and those are used in the process of perpetuating violence against women, then the impact is different. So, for example, disabled women who are also having some other kind of disorders of a neurological nature, who sees all the time, even in the middle of therapy, we have to rethink our structures of how we work with them, because we might be only able to do this one. They're seizing half the time in the session. So what I'm saying is they experience the impact is very intense because of the cumulative impact if they were told that they were disabled and nobody would desire them. Therefore, nobody would believe them that they were sexually assaulted or they were whatever happened, particularly in terms of sexual assault. But yeah, so I just wanted to make a few comments.
Thank you. Yes, Toby?
I find in a similar vein of, I work with a lot of women who've experienced trauma.
Mm-hmm.
A number of years ago, I actually told my supervisor manager at that time, right now, I can't because I'm being triggered. And then I did some of my own therapy, and then now I work, that's my main client base, right? But I also use sometimes the term we, if we are talking about the experience that women who experience violence or that even sexism in society. And so I do incorporate sometimes this is a common experience and this is sometimes what we experience.
To show you understand what they are going through, and it is normal when you have that kind of experiences.
Mm-hmm. So I don't necessarily disclose specific examples, but using the term we to have the general, and then move more into their specific.
Mm-hmm. Anybody feel that I have done something because of my self-disclosure and my client also lighten up and, feels so good about it?
Yes. I do have clients who are going through therapy, cancer therapy. And what I know, the first question for them is, why me? And they looking at their situation from the position as a victim. And the process of healing on the physical level is as important as the process of healing on the emotional level, on the spiritual level. So when those therapies, because I am a cancer survivor, the moment when I disclose that, there's the click. So you know what I'm going through. And using my methods when it comes to the pushing away the why me questions to what can I do to make myself stronger. The doctors are going to take care of my physical body, but my emotions, that's me. And just teaching them the methods, then you see the light, you see the progression, and you see the huge difference over the time. I'm stronger, I can make it.
Yes.
Yeah, I actually run the LGBTQ groups at the college, and very similar. A lot of times students will come in and go, well, is there any queer workers here? And, when I do self-identify that, I am a lesbian, there does seem to be a connectedness, where they go, oh, okay, then you have a, whether it be truthful or not, it's truthful to them, like, oh, okay, now you must have an understanding, or a better understanding than somebody that may be, straight or what have you. That just seems to be, a connectedness that they feel, whether it's true or not, because, I believe that, it's meaningful to them, so that in terms of self-identify or self-disclosure, that would be.
That's very important, isn't it?
Yeah.
And you also realize how difficult it is for them to come out and say it.
Yes, that's right. Especially if they're not out yet and they're just coming out. It gives them a realm of, I think, safety and
especially young teenagers.
Yeah.
Sometimes.
Which we have in the common.
Yes, and feeling rejection and
Yes.
And so, Lilian, I think we can also self-disclose, so to let clients know that we don't understand. It's not also about understanding.
True.
Right?
Yeah. We're on the same side. I do, that's
Sometimes
normalizing.
So like I just, like who goes to the clubs and she smokes and does drugs. I don't understand that life, right? So I have to talk to her and say, I don't really get that. Can we talk? So in some ways I am disclosing because I don't get it, right?
Yes.
So, a critical piece I learned from my work, and both as a survivor, many of us are, possibly in the room as well, is that your process, your self-disclosure should not take over the therapeutic process. Where the client starts looking after you and says, oh my gosh,
Thank
was that
you.
for me? And you have to really work them when they go to that pattern of rescuing and taking care of somebody who's in a position to help them. So the self-disclosure is very tactical, and it's mostly in the context of the issues that are presented by the client.
That's very important, because we are made of the same stuff. And when somebody empathizes with us, all of a sudden we're so, especially you build this relationship, close relationship, I'm going to help you. And you say, well, it's legit, so, we can share. But you have to be very, very careful about the quantity, the quality, and the timing.
Absolutely.
If sometimes we are just like them. If we were in that situation. So that if we have learned empathy, it's so easy, we acted just like them, and then we started forgetting who we are, what role we play at that point. And don't forget, there's only 50 minutes, an hour. If you're going to disclose yourself more, you're taking away the time from your client. So it has to be something the clients can use. It's a tool, isn't it? And you have to use that tool appropriately, and you sharpen that tool so that it will be effective. Fair enough. But it does make yourself vulnerable, and you have to be put. I'm going to ask you one question. I wonder if you have ever thought of. Should a counselor cry? Should you use tears? Sandra.
Honestly, I cry a lot. Like, I get teary a lot. Like, when they share that experience, so it touches my heart, and I am who I am. I don't want to hide it. I feel like I'm not gonna fall myself well, but I think it's okay. And then I still say, well, excuse me that I'm sharing this moment with you, and to be honest, to disclose that this is how it touches my heart. Now let's move on.
Comments?
I don't know, but I consider myself an emotional person, and I do feel very deeply because of the kinds of issues that my clients go through. And honestly, it's like sometimes not much, but I wouldn't be comfortable like crying in a session. I can think about one situation where there was this and I mean, she was really, like things are just being piled on to somebody. Every time there's like something else, and it had to do with her health. And I felt it kind of like touching a part of me. And honestly, I had to excuse myself. I said, just give me a minute, I need to run to the washroom. Like, honestly, and I just had to go in there and have a cry, dry my tears, and come back. It's like, yeah, but I think it would have affected her in a negative way if I cried in front of her, because in a sense, she's looking to me to, you know what I mean, help her work through that. Well, that's how I saw it, but I wouldn't.
Yeah, my concern is that the person would then go into trying to care for you, right? So that's my concern about crying.
Yeah. We also talk about congruence in sessions, right? The whole concept of what that is about, and that the emotion that you're feeling. Like, I think we need to contain it. And I think if I were feeling that, then I'd probably slow this session down a little to kind of contain myself. I'm not sure if I'd really. I might get teary, but I might not cry.
Yes. I have to agree with Toby. Like, when what came to mind was it really depends on the client, because I could see some clients with me totally jumping into, especially older women who kind of have that more motherly approach, like just totally jumping into that. Well, let's care for you, and it's okay, and then it totally shifts that session because it's now about my reaction to it, and I could see it disrupting the therapeutic relationship because then that might make the client hesitant to disclose anything, because then they'd be worried about how I'm going to react, and if it's too much for me to carry, and then it might actually be disruptive to their own process.
Thank you.
You use a process of reframing and redirection. As it occurs. That's it. Or you validate it because I'm sorry you're going through such a rough time in a very meaningful way. But it's also how we approach tears. Because most women don't have permission to cry, or they cry too much. Especially in my experience of working with racialized women, they do not have permission. Black women, women of color, as workers, employees, as therapists, as clients, do not have the luxury to cry. So you have to have that racialized context also. Or are you creating an environment where the person can begin, and we express grief and loss in a different way also. So there's so many factors, but the key fundamental thing that has worked for me is saying very often to people is sometimes tears are our only witness. And by giving yourself permission to release them, you're actually validating the reality, especially in the context of torture, violence, etc. There are no witnesses at the end of the day. So it really works out very well. But you can say, I feel your pain.
Well, yeah, but it's the timing of it.
Yes.
For me, it's not a question of not crying at all.
Yeah.
Keeping it, it's the where, you know what I mean? But after the session, I mean, I went to my supervisor and we talked about it, but, you know, and I'd be okay crying in front of him. You know what I mean? But I just thought it wouldn't be, it's not.
It's your intuitive wisdom that is telling you what is best for the client, and you have to be comfortable with it. What you did was just basically emotionally distance yourself so you can be fully present for your client.
Yes.
You did what felt right.
Thank you. Yes.
It's more of it's a comment, but also a question at the same time. I think as a professional, you still need to maintain your professionalism. So I think if you're struck by a moment, somebody sharing something very personal or intimate, and you're struck by it, perhaps your face will show if you're going to show emotion just by your nonverbal, like you empathize, and then maybe a tear coming. And then if you can't control it, to excuse yourself from the room, but that might not be a bad thing for the therapy because the client might need that moment to themselves. Like you know, silence is sometimes important, but silence can be uncomfortable. It gives them a moment to themselves and gives you a moment to kind of to gather yourself. But I'm sure both sides know, like both were affected by that. It might not necessarily be a negative thing. So it's a comment, but it's a question too.
Thank you, Steve.
I think there's a difference between experienced sorrow and witnessing, as you were saying, and falling into your own grief. Right? And if you're, you know, experiencing sorrow in front of your client, it's about your client, it's not about you. Right? You know, and if you tip over, right, and that's the point, you know, where you're in your countertransference. And, you know, that's the point when, you know, you're not helping your client, right? You're immersed in yourself.
I can see there are personal characteristics. Some people could cry at the drop of a hat, and some people could be very, very stoic, and they would not express. And we just have to accept ourselves, we are different. I had a graduate student, during the first practicum, I could see in my group supervision video, she was crying before the client cried. And in 15 minutes, she opened the door, she came straight to me. I can't control and I don't know what, it was so sad. Leaving the client, it was very difficult for her to control her emotion because she was just so kind and so empathic and everything else. So you have to, this is why you have to know yourself, don't you? You have to review yourself and say what kind of a person I am and how do I react to tragedy and what are the things. You have to be true to yourself, right? And yet You have to use yourself as a tool. And as I said, you have so many aspects of yourself that could be used as tools to help your client. But you've got to remember, you are there for your client. And you use your tools appropriately. When to start, when to stop, realizing yourself. You know, I'm going to pour it out, what am I going to do, right? Sometimes you say, excuse me, you know, and what would the client feel if you were the client? You say, oh my goodness, my counselor's gone out. What did I say? What did I make her feel like that? You know, am I exaggerating? And don't forget, some of the clients, they do, not knowing that they were exaggerated, but that's how they felt, right? And that was traumatic for them. So whatever they said, it could be interpreted differently from the real situation. As a counselor, you got to see the total picture. You want to see the client in that environment. And you have to say, I am here to enter into their world. But realizing my own characteristics, and you have to hold, somebody was saying, you train yourself to hold back. And so that they will accept you as you are. And we're not pretending to be somebody else. But then we are tools, and it has to be, you know, I always feel the amount of disclosure has to match the need for that moment, for that client, in that setting. And the quality, the way you project yourself, has to be not as selfish. And just, I'm so bad, you know, I'm going to say something. Or, you know, I just realized that I had gone through that and never thought it was, and somebody mistreated me, you know, the transference and the counter-transference started. And so there's just so much of self-awareness and so much of skill to hone yourself to be a good instrument for counseling. And also the relationship. If you disclose too early when the relationship is not firm, you don't trust one another, you are still testing the ground, and that is the time that you realize it's not appropriate. And if you do it, you have to do it in good quality, at the right time, and during the relationship that is firm. Okay? Does it make any sense? All right. And for that student, the goal of supervision was to hold her tears back. At the end of the year, you know what she said, what I have accomplished is I understand my tears, and I am able to use the tear effectively. And then I found this article, and the title is, Do Therapists Cry in Therapy? The Role of Experience and Other Factors in Therapist Tears. So if you want a reference, I can have it for you. Yes. All right. Any other areas of self-disclosure that you wanted to talk about? Yes.
I find a lot of people ask me, they'll say something like, are you a Christian? They'll ask me about my religion. And I found, and it's usually someone who identifies as being a devout Christian. And so my sense is that it's important to them that I understand where they're coming from. So I found the answer that works the best is, I was baptized as a Christian, and then I move forward with it, and they seem to nod and be satisfied with that. I don't say, no, I don't go to church. Well, I don't know how much I believe, but I don't get into
it. You don't want to be defensive.
No, and I also, and if I say anything more, if it's something like, I'm open-minded and I respect all religions, because I work in a hospital that's in an extremely multicultural area, so we have people from all kinds of religions. So I will sometimes say that, but I find if I just answer them, that seems to satisfy them. If you try to dodge it and kind of go back, throw it back to them, they don't seem satisfied with your, as if you've danced around it, that well, blah, blah. You know, all those things we learn in school about how to dodge these kind of questions. I just find a simple answer to them like that seems to work. But I have been asked that a number of times.
Right. How many of you have fear of disclosing your religion? No. And well, how would it be if I asked, why did you ask that question?
Sorry, can you repeat that?
Why would you, no, for in that scenario, instead of, kind of dodging here and there, say, why did you ask me that question? So then they might open up and say.
The answer is, because I want to know if you can help me, I want to know if you understand me.
And that will be
because I tried those sort of replies. Why is that important to you, those sort of things?
Now, religiously, who do you think I am? Anybody knows who I am without asking that question, that direct question? Do you know who I am? What my beliefs are? Does it bother you that you don't know?
No.
Can you find out in these settings what my religion could be?
Ask you. I can ask you to the break.
You could ask me. Yeah. You see outside the door when you walk in, what does it say? In this house the Lord provides. Right? We don't put a label, I'm a Christian. Right? But you look at the display, you look at something, they say, you somehow know, right? So your clients too, sometimes, the way that they wear the cross and the way they dress, you pretty well know their religion, right? But it is good for them to ask. Oh, you say, oh yeah, well, answer. This is what you want to train, and this is what this course is supposed to be, is that we want to free ourselves from all the restrictions that the culture had imposed on us, so that we would be authentic. We'll be open. We are an open book. However, we are entitled, we have the right to keep secrets and privacies. And that is something that, even husband and wives, they said, oh, we're all just one body. But I think they do have a right to keep something that they don't want to share. But the fewer of those, the better the relationship, obviously. But there might be something that you're not ready to share. And that's when sometimes the break up is due to those things that you are hiding not very well. Okay, I got 2 hands. Yes.
Yeah. The other thing that is interesting, because what we're talking about is the client coming in, and they really are sussing us out. They're wanting to know.
Exactly.
Wanting to connect with you.
Exactly.
Because at the end of the day, it is customer service too. Do you know what I mean? Like they're looking for a therapist, and they want somebody that is a match. And I may not be the right match for them.
Exactly.
Or, or vice versa, maybe possibly, right? So, I mean, I think that there is a real important value to, allowing for that to happen, to unfold, to say, hey, you know what, yeah, you can come to me today and maybe a couple of times, but if it's not a right match, maybe we can look at a referral, those sort of things. And we do that even because we have thousands of students. So, Marcy may say, you know what, Hall, I wonder if you could take this particular, student because I think they would do well with you. Or I could go to her or Renee and say, yeah, I think they would do very well with you because you have some expertise in this area. And I think that that's a real value when and I think it's respectful to the actual client as well.
Mm-hmm. Yes.
Oh, yeah, I just had a question as you mentioned that. What were your thoughts, or maybe others, about having, I don't know, like you have, you made a reference to
a little plaque out there, yes.
About having, whether it's symbol, a thought, whatever that reflects you, your value or your, you know, religious orientation or whatever in your office, and whether or not people see that as creating, you know, barriers for clients who you're serving, especially, you know, for me, I work in Toronto, again, multicultural, and so on. You see that, how do you feel about that?
Like if there was a cross hanging in the office or something, or a
cross, or you have a little, you know, frame that says Lord provides or something like that.
Yeah.
Yes.
I like the, you know, getting to kind of why this is important for the client, because it could be a safety issue. The disclosure they want to talk about could be disconnected or incongruent or against their family's belief or their religion, and the embarrassment, shame is something that is really strong coming in. So, like you said, I think they're also checking out their safety, judgmental, looking at the environment, what's on my desk, you know, kind of doing those things.
You're right. And sometimes, you know, because if they were raised in a certain religion affiliation, and they don't like what they say. So if your counselor is from that religion, they say, more or less, you're going to give me the same thing, right? Or you're going to make me go back or make me such and such. So again, you see, when you have a client, in the beginning, it's a testing time. And it is finding is that, are you a good match in personality? Are you a good listener? Do you understand? Do you have the background to understand the depth of my pain? You see, there's just so much involved because we are sharing our lives with other people's lives. So it is a very, very difficult task. You don't make money out of it, but, you know.
To piggyback what Holly was saying with regards to their feeling you out, I remember as a practicum student, I had this lady from Alberta, and when she met me, I was young, and she said to me, I don't know if you can help me. I said, and it was weird, and my natural response was, I don't know either, why don't you just tell me what's going on, right? My best client.
Being honest, right?
Yeah, I thought race was an issue for her. I thought the fact that I was young was an issue for her.
Yes.
And then, but because I just was who I was, you know, and it worked out okay, but I said, I don't know either. And then I think it was like a knee-jerk response. Like you know, I was younger too, right? I probably wouldn't say that now, but at the time, I was like, oh,
And we did talk about honesty. We did talk about sharing. And those are all important. And this is why I took the challenge to give this course, because I think this is so important. Because so often when you have a curriculum, you talk about the different approaches and you practice the approaches, and you've forgotten that we are the tools. If we don't understand how we could fit in, we might never be. For example, sometimes being young, well, okay, yes, I'm young, I don't have your experience, but I could consult and I could learn from you. And just try me. And if I cannot handle it, I got my supervisor. Right? And it is 10 o'clock, and I think Paul is ready for that. So why don't you get up and stretch and take a coffee break and have some refreshment, and then we'll move forward for 2 hours. Yeah, move the arms and stretch your legs. That's good for you. Huh? I was just oh dear. Hello, online fellows and partners. I am so sorry, I just ignore you. Actually, we did not. So, anyways, I wanted to make it clear, but by the time you finish next weekend, and we will receive your assignments, which I'm going to explain a little bit of what assignment you might hand in. And then we will send you a certificate online by attachment. And with that certificate, we have a letter and outlining our objectives and the lessons that we have covered and everything else, so that people know, within the 30 hours what you have learned. Okay? And we're still working on the syllabus because of the different, we want to update our references. And we're going to get that. I will send it to you by attachment during the week. And I'm talking about the assignment. We find it, if we ask you to read and critique a certain articles, and what you get out of it, it is good. But a lot of people were telling me that they don't have time to read and they haven't written for so long, blah, blah, blah. But I still think that when we give you the references, it is good to get some of the articles that you feel interested in. It's going to be, helpful. And this will help you even after the course, that will be something. But there is one thing I want you to spend some time, is the inventory of self. We're going to give it to you at the end of the day, so you have the whole week to go over. And some of my students had done it twice. In the beginning, this is how they feel about themselves, this, that. But now I think I'm going to change, it's okay. It's for your own edification. And when you are done, I want you to send it to me by attachment or mail it. But if you send it by email, an attachment, as soon as I printed it out, I delete that, because that belongs to you to keep confidentiality. And if you wanted to send me a hard copy, it would be okay too. Are there any questions about? Yes, no. Yes, all the articles are online. If not, you ask me and I have them. Yeah. And now we're going to be dealing with the next big topic, is how do you manage transference and counter-transference? And I think first you must know, what is transference? How do I know there is transference? And what is counter-transference? And how does that help? We could use it to our advantage to help the client. You see, sometimes people don't understand the whole process, and they say, stay away from this. But you could use it wisely if you understand what you are going through and how you could help others. Here's Paul. Thank you.
Good morning, everybody.
Good morning.
Later on, I'll need 2 guinea pigs to do role play. So you better, now she's hiding behind here now. Wait, oh, okay, you're hiding, eh? Yeah. Well, there's a lot of room for you. This slide is taken from one of the assigned papers. Last night I'm still working on the computer syllabus. We want to revise the syllabus we used last time. I'm still in the process of revising it. Okay. So this little table from the paper, which is required reading. By the time you receive the syllabus, you will see which paper it is. I forgot the name of the paper. Okay. But anyway, so this is an example of how attributes of the therapist can influence their interventions. For example, if you have a rigid personality, you tend to overstructure therapy. It makes sense, right? You are very rigid, you plan, you stick to your plan. Now, the second one, if you are uncertain about the case, then you fail to structure any therapy. The third one, if you are exploitative, you will use self-disclosure inappropriately. Now, do you understand that? You use your self-disclosure in order to either explore that person's emotion or control the other person. So you use self-disclosure for your own gain rather than for the benefit of the client. Okay? And so on and so forth. So in sum, whatever your personality attributes are dominant, that might affect your therapy. Okay? I just want to go back. What is?
20. Good.
Okay. Last time we talked about 4 choices. I say the true choice is number 4. I didn't tell you what it is. See? Now here number 4 is the interaction between the true self and professional self. So that's the key. That's what you learn here is that you learn how to know yourself, you know your personality, how you bring yourself to interact with your professional role for the benefit of your clients. If it's your true self, that true self might be harmful to the client. Or some aspect of true self might be harmful. So you have to bring your true self under control and make the best of yourself in the professional role. Okay? Any question about this one, about the last one? So finally, we go to that point. Yeah. Now, yesterday, there's a blackout, so people online missed out this slide. So they asked me to mention that again. Okay. Remember, when you are in a session, I hate to say there are 2 of you. There's a professional you and there's a real you. So there's always a tension there, right? When sometimes your professional you, your real you is a professional you. But sometimes, like normally you might disclose emotion or other thing, but you don't want to bleed all over the client, right? So you just have to control yourself. Remember that now you are a professional, so there's always tension about how make sure that your real self does not interfere with your professional self. Ideally, your professional self and the real self will be exactly the same, okay? But it's often not the case. So therefore, spontaneous self-disclosure must be monitored. You cannot just give an example, okay? Suppose you have gone through a clinical bout of depression or severe depression. Now you're working with a depressed client. Should you tell her that, you know what, I too have gone through that struggle? Is it appropriate or not appropriate? How many people say it's appropriate? No?
I think there's so many variables, it depends.
Yeah, okay. Okay. Just generally speaking, you're a person, you're working with a client, some depression, and you have gone through the same thing. Is it appropriate to say, look, I have gone through the same thing? Is that appropriate?
How would it help the client?
Huh? The client is struggling with depression.
No, I don't think it's
It won't be
helpful
helpful.
to say that, no.
It is helpful.
Not generally.
I think in some situations, I like the
Yeah.
we, but.
Yes, so
But from my perspective as a client, I have depression. I'm looking for someone who's gonna help me to walk out from the depression. If the therapist is in depression, what kind of outcome I can expect?
not including
No,
it.
in
I'm overcome.
In there.
Overcome, oh, okay. I thought
Depressed right now, so it's like.
No, I think in fact, the client, depending on the point in therapy where that comes up, I think the client could benefit in that if you have overcome it, then there's hope I can overcome it. So, yeah.
There's no right or wrong answer, okay?
Right.
There's no right or wrong. I mean, you can, there's no right or wrong answer. It depends on your personality. It depends on the case, okay? You know, personally, I don't think anything wrong. As a way of encouragement, I say, look, I've gone through the same thing. I've overcome. Use this method. I think this will help you too. So in that sense, so my purpose of disclosure is to give them hope, right? Encouragement. On the other hand, if I tell a person all my troubles and all what else, that's too much, right? That you know, I come to see help. I don't want to hear all your miseries, all the days of misery, right? So you have to you have to be wise, right? And any question before we get on today's topic? Your last chance. Okay, lecture 3 now. Maybe either was quite finished that part.
We did cover some of that in the first hour.
Okay, lecture 3, okay. Whoa, why? That's scary.
That's fantastic.
That's very scary.
I did not copy added this slide. At conscious mind, yes. Change that. Okay, Lina, she copy it. Then conscious mind, yeah. Why so scary?
It's not scary.
Huh?
It's not scary.
Not scary?
No.
Why? Why not scary?
It's actually fascinating.
Huh?
The different method of discovering yourself.
That's scary. Imagine that most of the behavior are not under your control. That's scary, right? A big, large part of your behavior, motivation, it comes from subconscious, unconscious area. So that's why we have a lot of problems, right? If we're all rational, if everything under the new cortex, under control of new cortex, okay? People, everybody's rational. The fact is that often we behave very irrationally. That's why husband and wives fight like dogs and cats. Because they're not rational. They're not rational. A third person say, "Oh, what do you fight over nothing?" If people are all rational, this world will be peaceful. And this is interesting. They did an experiment. The doctor will stimulate the motor cortex to elicit hand movement. Okay? So the patient doesn't know why he raises the arm, okay? Because it like the stimulation, right? You know that study, right? So then the doctor says, why do you raise your hand? Guess what the person said. What the patient said. Oh, I raised my hand to ask the nurse to come over. See, this person has a behavior completely beyond control. Yet our tendency to make sense of things, say, oh, I raised my hand because I want the nurse to come over. So we're trying to use conscious explanation of something that's completely unconscious. You know, right? And there's so many experiments now to show that our behavior often are controlled by unconscious impulses, unconscious desires. We now will find out, you know, it's really scary because you wonder, sometimes you wonder why you do that, you wonder why you say that, or why anybody would say something so silly, or act so silly, so irrational. Because this is because of Freud's discovery. Now, for a long time, people say, oh, Freud's theory cannot be tested. You know what? The last 20 years, there's a lot more research comparing psychoanalysis of psychodynamic therapy with other kind of therapy, where you come to deep-seated personality disorder. Psychoanalysis is the best way. You know, with deep-seated personality disorder, they can trace back to childhood. You know, long-term psychoanalysis still more effective than short-term solution-focused therapy or behavior or cognitive behavioral therapy, because there's so much stuff there. There's so much stuff that affect you you're not aware of. That's quite scary. Yeah. Now here I copy from Professor Lori Marino. She listed a whole bunch of defense mechanisms. Can you see them? No. We ask Josh to enlarge them with
Right here.
Oh, you mean I enlarge them now? Okay, I ask them. Okay. You know about computer? I don't know. I will know psychology.
Talk amongst yourselves.
We surely give the credit to the person.
Yeah, well, this is just for the sake of being able to see it.
Is it better?
Yeah.
Yeah.
Do magic, eh? Wow. Look, all defense myself. That's very scary. Does anyone know how to do acting out? Eh? Seriously, do you know how to do acting out?
All of them, or you want
To do acting out. I have seen my granddaughter acting out. She screamed. So when you behave like my granddaughter, that's acting out, right? Okay. Any question? No. All these defenses are unconscious or subconscious. They are just below the surface of your consciousness. You use them without realizing that you're using them. Now, I think the unconscious motives or defenses are important for self-therapists because you see, often many of your clients' problems are from that. Secondly, you have to watch out that you do resort to those unconscious defense mechanisms in your conversation with the client. If sometimes your clients might accuse you of something, right? They come and blame you for something. So one way is to answer that charge or that accusation in a rational, professional way for the benefit of the client. Another way is fall into the trap of defense mechanism as a human being, right? Now, who is talking about that? The genius. Freud, the genius. The sex-obsessed Freud. The genius, right? In the beginning, there's Freud, who discovered to enjoy. And he's the first person who used the word transference to a patient called Dora. See, Dora fell in love with Freud. Okay. Do you have any client fall in love with you? No? You have? Oh. So how do you handle it?
End up transferring the client to someone else.
What?
End up transferring the client to someone else.
Transfer. Yeah.
Transfer 10, okay. Now here, at that time, Freud did not know any better, okay? So this Dora fell in love with Freud, but not really fell in love with Freud, but she fell in love with the phantom of her old lover. So that phantom just attached to Freud. So only later on, Freud realized what's happening. So he called that phenomenon transfer. So this person terminate the therapy, quickly, okay? Because her need for love was not met, okay? So this is quite common where some kind of feeling intrude into the therapeutic relationship. So it's understandable because you meet someone week after week and sharing intimate stuff, right? So it's not unusual. Okay. And here talk about a little bit more deeper now. We talk about when a client comes to see a therapist, so there is an implicit contract, right? Fee for service is a professional arrangement. Right? You pay the fee, you see the service, just as the doctor got service. So there's an implicit legal contract. You pay the fee, you receive help. So the therapeutic alliance implicitly means that the therapist and the client will work together to solve the client's problem. But what makes therapy more complicated is that often the clients come to you with a covert agenda. Okay? So they come to you not just to get help, but they have unconscious, unresolved issues behind. For example, my SEUS has seen a client for over a year, okay? For a year. And my SEUS complained to me that this client is not making any progress, and he's afraid of going out of the apartment, and afraid of going to school, and doesn't want to make friends. So he paid the psychologist to come to his home to help him. He paid a Chinese doctor to come home and pay him. He had money, right? So here's the case. So I thought, well, maybe he doesn't want to get well. Okay? Because basically, there's no problem whatever. He's tall and big and strong. I mean, you look at him, you never think he's sick, right? So their clients refuse to get well for some hidden agenda, because he's not capable of making friends. So at least by playing his sickness, he got psychologists come to see him, Chinese doctor come to him, this person come to see him. So that's his way of manipulating the psychologist. Now, in terms of unconscious motive, so sounds like what kind of problem he has. Sounds like dependence, projective identification. A big term. Okay? He had a dependence need, and he had to project someone so that will meet that need. So often, people are complicated. So it's not straightforward problem. These unconscious things make things difficult. Here is yeah. Okay, I just can you read it? Now, projection, we do it all the time. Can anybody give me an example of projection?
This is your fault. You're not listening to me.
Or in marriage, one of the projection is used a lot when one spouse usually accuses the other of infidelity. You're cheating on me. And I had a client with that situation. It's projecting quite a bit apparently on this.
Okay. Do you are you guilty of projective defense mechanism? We all do, right? We all do. Teresa, give me an example.
I'm so perfect.
Huh?
I'm so perfect. Because you're so perfect. I just did it. I'm projecting my perfectionism over to you.
Usually, for example, I'll give a personal example. Okay, see, when my older son is younger, a teenager, okay, teenager is difficult to handle, right? So usually when I should correct him, even before I open my mouth, he was sick. He said, "Don't be angry." I said, "What? I'm not angry with you. I'm just trying to talk to you. It's not preemptive strike, all right? He's angry with me. He projects the feeling to me. He said, 'You're angry with me.' He's a teenager. He doesn't realize that. I mean, husband and wife do the same thing, right? Can you give me an example of my wife? Can you give me an example? Due to projection?
No.
No? Sometimes she will say, she'll mad with me for some reason, okay? The one she said, "Don't be mad." I said, "What?" I said, I'm not mad, I'm just doing something. She will project her anger to me, say, "If I'm mad." It's very common, right? So you got that now?
He is such a perfect husband.
So do I do project on you? We're all guilty of projection, is very common, okay? We all project our needs, our feelings on other people, okay? Other projection, okay? Now, projective mechanism, okay? Now, we tend to see what we expect to see according to our mental state and act towards other accordingly. What does that mean? Do you see me? Do you see me? No, you don't. You see what you expect about me. See? We see what we want to see. We don't see what's out there to be seen. We often see. So there's a case of danger, right? But I see it. That's what I witness. You know, I witness black versus white, okay? I witness a car is often wrong. The black people expect to see white police abuse the black, okay? So they see the police do all kinds of things. The white police expect the black teenager he can do bad things. So even they are not doing bad things, they see them doing bad things. So we do not see reality, we see what we expect to see in our own head. So that is the danger. You know, when husband and wife come in the same situation of family therapy, everybody have a different account of what happened. Because everybody see the thing from their expectation, their perspective.
And everybody's right.
Huh?
And everybody's right.
Everybody's right. But there has to be some. See, here the trick is that everybody's right, but everybody cannot be all right. Right?
That's right.
Mm-hmm.
So the trick is that how to get everybody to realize that there has to be some reality out there. Do you know what is the hallmark of mental health? A sense of reality, right? The more you behave and think according to reality, the healthier you are. So family members need to see what actually happened. If they have those things of reality, there'll be more agreement. If everybody sees things from their own fantasy, there's no solution for marital conflict, for family conflict. Yeah. Always fight like that. To each believe they see something in another person which is not there. So projective mechanism can be very, very damaging. Okay. Now, What's different between projective technique and projective identification? I'm concept of the author inference. Okay. Forcing a kid to another person the feeling thought of self, but by the fact that the individual does not fully disallow projected. It's just viable reaction on a person. Frequently, the individual include those very feelings to others that were believed to be there. That is very complicated. Do you understand that?
No.
It's this is a very difficult concept. Okay? Let me see this a bit clearer. Okay? Here are two people. Okay? This guy is worried about gaining weight. And they call him Mark, okay? There's actually a case about this guy. So Mark is gaining weight. So when he sees John, he says, "Oh, you're getting fat." John is not getting fat, but Mark is getting fat. There's actually a case there. So he's projecting his fear of always onto the poor innocent victim, John. See, you are getting away. Guess what? After Mark's gone, John looked in the mirror and said, "Yeah, maybe I am. Maybe I'm bloated." So he is identifying with the projection Mark put on him. He identified with that. Do you see what's happening here? Right? So Mark projects this fear of fat onto John. And John unwittingly accept that projection, identify that with that, and really worry about himself getting fat. Okay. So this kind of projective identification often works in clinical case in terms of transference. Okay. So any question about this slide? Get some idea now, all right? So not only project something on you, but you actually identify with that projection. You really think that you're fat. Any question? Now here's another case. Here's another projection, it's called anger projective identification. She hit herself, and then she said to the daughter, "I hate you." Now, where did the mother get this idea about she hate herself? The grandmother goes that one further. The grandmother told her, "I hate you." As a result, she hates herself. She hates herself, and this hate projected to the daughter, so it's transgenerational, right? The grandmother passed on to the mother passed on to the daughter. Do you follow the logic? It's transgenerational. Why on earth should somebody hate themselves? Somebody told me, "I hate you. You're not worth it." So the voice, they were part of the experience going on, right? So their voice become their identity. I'm hateful because my mother said, I hate you. So that become a self-identity of poor self-esteem, of self-loathing. So that kind of self-hate sometimes will project it on to her daughter. Pass on. So the phenomenon of transferring is that unconscious transfer of feeling attitude from past of the person to the present. So usually it's from the past, but the key is what? The key is that you transfer the feeling not only to the present, but to a situation totally inappropriate. You're transferring an attitude feeling that might be suitable in the past, but now you transfer the situation, in constant situation, that's totally inappropriate. And so either they will talk about borderline personality. See, a person with borderline personality disorder or problem is most likely to be guilty of this transference because they have difficulty differentiating reality and fantasy. So real difficulty. So therefore they're more prone to transfer past experiences into the real situation. So the patient unconsciously projects a wish but a met need in the past to a therapist. Okay. If you have an unmet need for love, okay, you grew up, your father never loved you. So what may happen if you have a therapist who is fatherly, who is kind? So it doesn't take a stretch of imagination to say she might develop fondness to the therapist. Now, is that wrong with that? Nothing wrong with that, yeah? You're fond of your therapist, you like your therapist, but there's wrong with that. But it becomes wrong when you actually obsessed with therapist, manipulating and hoping that he will identify with the role you project on him and will love you back. Okay? Love you back. For example, in hospital, the nurse will say, we're able to trick the doctor saying that, do you like me? The doctor, oh yeah, you're a nice person, I like you. The doctor, the innocently say, I like you because you're a good patient. The doctor doesn't know what's going on in her head, right? The next thing you know, what? She'll tell everybody that she loves her. In projection, right, but she did not the doctor, she's able to trick him to say, I like you. So that liking become an obsession. And he turn around and say, oh, the doctor's in love with me. That's the communication. And, so now here's something, okay. When the patient projects something on the therapist, they expect the therapist to play the role projected onto him. Okay? A kind project a role on the therapist. It's transference. Okay? Countertransference is occur when the therapist unconsciously fall into the trap set by the client. When the therapist begin to play along, play a role that projected onto him, he'll play a loving father that the daughter, the client never had. Or he played a role of a lover that the client never had. So when that happens, the therapist is no longer effective in helping him because he became part of the problem. Do you follow me, right? He became part of the problem. He is no longer effective in helping the client. Patient-negative therapy may be provoked by therapist back here rather than here's something. Right? Be careful not to call everything transference. Okay? If you behave badly, your client has reason to be mad with you. So that anger is justified, it's reality-based. If you are a very kind person, your client has reason to like you, right? So liking you or getting mad with you can be reality-based. What the main difference between reality-based and transference? What the main difference?
It's not reality. It's
No reality, right?
the situation.
Yeah. In the case of transference, there's no reality there anymore, right? There's no reality base. Secondly, it interferes with your functioning, interferes with your relationship, because you mix up reality with fantasy. Typically, transference is based on some kind of fantasy developed in childhood and become part of the unconscious mind, the big iceberg underneath. So if your behavior comes from that area and unrelated to reality, to present reality, then you cause trouble. So what is the solution? What is the solution? What is the solution for the problem of transference?
I think you need to address it directly. You know, like there's, I mean, positive transference you can use in the therapy. You know, if the transference isn't productive for the therapy, then it needs to be addressed.
Usually, okay, thank you. This is very complicated because usually, let me backtrack a little bit. For you to believe that dream analysis is the best way to help people to bring the unconscious mind to consciousness, okay? Dream analysis. Later on, they say, well, dream is fine, but the most productive area of therapy is transference. Because there's so much transference in everyday reaction, in everyday interaction. So transference is a fertile ground for analysis. How do you bring the transference from fantasy in reality? Okay, so my boss told me I have to stop. So, okay, let's continue this. But that's the whole area. Transforming the basis is the main way to bring your conscious mind to consciousness through interpretation. We'll explain how that works, okay? Interpretation is the way to, you know. Okay, we'll have a break. A break, 50 minutes, right?
I know.
I know. Just right.
We will have lunch from 12. We will have lunch from 12 to 1 o'clock, and I hope we'll get back here at 1 o'clock because we have so many things that we want to cover, and you have so many questions you like, discussion. So we're going to be not straight onto the schedule, but we wanted to accommodate all the needs and make you feel that you have changed yourself, you have grown, you have learned. Okay? And here's Paul again.
Okay. What can you say about transference and countertransference? The one statement I want to make again is that a proper understanding of transference and countertransference is essential for good practice. Because if you, it's difficult to explain, but if you do not have a good understanding about the danger and the prevalence of transference and countertransference, and often you fall in the trap that your client set up for you and ruin your career. Now, theoretically, the whole idea of transference is come from Freud, all right? But the idea of projective identification comes from Melanie Klein. Have you heard about her? So Melanie Klein is
Dr. Wong, would you please enlarge the slide?
okay. Better? Thank you. Right. So Melanie Klein took Freud's idea one step further. Okay? Because Freud, when he talks about unconscious motive, see, Freud is working with the intra-psyche model, working within the person, intra-psyche. But Melanie Klein extend that into interpersonal unconsciousness. Okay? Become a relational thing from the intra-psyche to inter-psyche. I mean, the whole theory is pretty complicated. It's based on the child's attachment to the mother. For example, if the child is enjoying the feeding in mother's arm, her needs is satisfied, then this attachment is good breath. If the baby doesn't get enough milk, get angry, attacking the nipple with the teeth and whatever, that's a bad breath. So the mother has good breath and bad breath, and then a splitting occurs, right? A splitting. And so it's a very complicated scheme based on the infant trying to cope with the relationship with the mother. Right? So as a result, they develop all kinds of projective identification, like dependency, objective identification, power, sexuality, and all kinds of projective needs are developed in childhood, during infancy. So it's quite complicated. I mean, at UBC, they have a course called, the book they use, called Projective Identification, but Cashton. the book. Actually, have you read that book? It's quite deep. Okay? They use that as one of the courses on projective identification. So we can't deal with all the detail today, but that comes from Melanie Klein. Okay. So now the question is that how do you manage transference and countertransference? Before the break, I mentioned that Freud discovered that if you recognize transference, countertransference, maybe that's the best way to bring the unconscious stuff into consciousness. Why the client understand why she was behave that way, according to the Freudian assumption that when you bring the consciousness, the problem is solved. Okay? When the issue is brought into consciousness, it's not a problem. Oh, I have this need. Once I realize that I have this need, then we'll find more reality-based method to meet that need. See, before those emotional needs, what is fear, what is love or dependency, those emotional needs is buried in the unconscious mind and projected to someone inappropriately. So what happened? It's doomed to fail, right? People project themselves. No way a psychiatrist or psychologist can become your father. There's no way the psychologist or psychiatrist or psychotherapist can be a lover. So those fantasies eventually harm the client. Right? Even harm because it cannot be fulfilled. Yeah. So Freud said that, well, it's not a bad thing to happen because what's the material to work with, okay? So trying to interpret this event to the client to understand, you want to meet the need for a father which you never had, okay? Or whatever the problem is. So you interpret, the psychologist will interpret the phenomenon through the client, interpretation, and the working through, and help the client to get out of that. But here's the trick. If you interpret the transference prematurely, what will happen? The client will feel insulted, right? Right? What do you think you are? What makes you think that you know? Before building a trust, before building a relation of trust or knowledge, the client might be very angry with you. Say, you know nothing about me. You know nothing about my mother. How dare you say those things about me? So it can get dangerous. Okay? But when the client is ready, when there's a firm relationship of respect, the client, oh yeah, that makes sense. I never thought about that. So that's one way, okay? The second point, promote a safe, secure, therapeutic relationship even when the client is able to understand. So the key is relationship. Now, if the client doesn't understand what you said, if there's already a safe, a secure, a strong therapeutic relationship, so that will allow you to continue. Right? But don't let the interpretation ruin the relationship. Okay? And the third point is even more important. The third point is that make sure you maintain a clear professional boundary. Because the problem occurs when the client fails to see the boundary anymore. Right? You know, the role of the psychotherapist and her path become blurred. So one way to overcome transference is to remind the client of the boundary, or especially in vulnerable clients, you have to be extra care. Even when you try to show kindness, don't touch. Okay, do that too close. I mean, normally it may not be a problem, but here is a vulnerable case. So you have to ensure boundary. So yesterday I talked about a case where I invite that person for dinner because he coming late. So that was interpreted as what? I violated a boundary, right? So anything can be misinterpreted. You never know how the mind works. So to play safe, you maintain a boundary, is protecting you and protecting your client. And recognize client's emotional needs and all limitation to meet that needs. So here's the thing. When a client projects their emotional need to you, you recognize there is a vacuum in the emotional life of the client. So you help the client recognize that she has this need, this emotional need for father's love, for mother's love, for a lover. Those needs are met, but there are more realistic ways to meet that need. So help them recognize the need there and avoid unconscious acting out. What would acting out happen? When you're burned out, when you're frustrated, when you lose your self-control, when you're under too much pressure. As a human being, you act out. I act out. But acting out will ruin your therapy. Get mad with a client, throw a temper tantrum, that would be unprofessional. Is there any questions so far? Now, use interpretations that resonate with the client. So here's the key, right? Nobody knows the client better than the client himself. At least they would think that way. So when you interpret, you have to interpret in such a way that resonates with the client. Yeah, that makes sense. Yeah. Remember earlier we talked about that the client consider you as a best sexual therapist if you impose your interpretation on her. When you talk about best sex therapist, that's it. Your problem is because of that. You are so sure about your interpretation, which doesn't resonate with the client, you backfire. You make you look like a bad therapist.
Excuse me. Do you have any examples from maybe, I don't know, from your own practice or
example of what?
Of transference being interpreted prematurely and how it can...
Prematurely. I don't put an example, okay, of prematurely.
Do you know law?
Well, premature simply means that before there's a firm therapeutic relationship, you should take some time to form, right? If you do interpretation of all the client's unconscious mind, you most likely get in trouble. In other words, that has to get to know the client much better. Do not do interpretation too early during the process, because it's a process, right? Usually do too early, it doesn't work. Because you do not know the client enough and also the relationship not strong enough. The bottom line is that on the safe side, to make sure that she can take a punch or she can take the bad news. Make sure that she's strong enough or the relationship is strong enough for you to reveal that thing she never thought about before. Was that a question?
Yeah, I just wanted,
Yeah, they said, people, I haven't seen any reported about the warning is that don't do the interpretation too early before the relationship is established. Now, how about that? You're a human being, right? I'm a human being. So, you're also capable of transference. Can you give an example?
Probably me and my boss right now. I mean, listening, Marcy's laughing because I think there's a good chance that I need to look at transference and counter-transference in my relationship with my boss right now.
Okay.
Because I do feel I'm acting out, that I'm kind of losing my professionalism. I keep kind of going back to, this is not how I want to be. I mean, and how can I get through to this woman? And why is she doing this? And it is reminiscent of major players in my life, growing up. So I think that I'm just looking at my behavior right now and what I'm thinking, and I think there's a good chance I'm causing transference and counter-transference.
Okay.
I'm expecting her to behave in a certain way. Why would I do that? And when she doesn't...
You're talking your boss, right?
My boss.
Okay.
And when she doesn't, I feel like I'm acting out emotionally, inappropriate to the situation. It's work. She's my boss.
So your boss, you have been working with your boss for how long? How long?
Oh, this is probably, 18 months?
No.
It's been a while.
2 years, sorry.
Okay, about 2 years. Yeah.
You see, there is so-called the boss syndrome. Have you heard about the boss syndrome? The boss syndrome is that most employees, I don't know about you, the book I read, okay, boss syndrome is that most people hate their boss. Most people hate their boss syndrome. So whatever their frustration at work, their happiness, they project it onto the boss. So in a sense, the boss cannot win, all right? Because there's so many people there, they project all the frustrations or the angers onto the boss. Oh, the boss doesn't understand. The boss gives me too much work. Or the boss doesn't like me. Or the boss favors another person. Or the boss is not responding to my feedback. Yeah. Or the boss change his favor to another person. So for a variety of reasons, there's a hidden agenda there, other than simply a work relationship. So I'm not speaking from the point of the overall picture. So there is a phenomenon called boss syndrome. So being a boss, usually a boss is feeling heat because he doesn't know how people feel about them, right? So it's the problem. Now, in terms of transference, in terms of counter transference, sometimes the boss will choose a scapegoat, okay, to project all her anger to that person rather than other employees. But whenever he is stressed out or under pressure, so he has let out anger something to somewhere. So he usually pick a safe target. Say, you are it. Well, this safe target may be a minority or whatever. I will project all the anger on that person and say, you are my target. You can do no right. So that's transference, right? Because it doesn't. The test doesn't agree with reality, right? You cannot stand it. She's always wrong. So whatever people's reaction is exaggerated, inappropriate, not supported by reality, usually that element of transference or counter-transference. Usually, okay? A reasonable person can get mad for a reason. You get mad with you without a reason, you say, aha, that's transference. Does that make sense? You're logical, reasonable, but they're doing it wrong, you got mad with me. If I have done anything wrong, you got mad with me, where does it come from? Where did it come from? So you begin to wonder, where did it come from? It comes from somewhere.
I have been quite watchful, working with abuse situation, and when there's a case, the male was the abuser. When I finish the case, I have to give myself enough time, because otherwise, when I go home, I tend to, if my husband was in town, the distance between, I just go, he represents all the male figure, because he is male, right? Then I realized that this transference. So I have to be careful that to clear that part up, put it aside before I walk into my home. So the long distance driving helped me. Yeah, so but then I have to be really watchful. But there are times I even say, give me some time, I'm not ready to engage. And he never asked me what happened. But so that's one thing as a therapist, I have to be cautious. Yeah.
Teresa is able to handle that because she's capable of doing reflection, right? Reflect the situation, say, look, reflection and also prevention. Think about the situation. So often if you are not in the habit of reflection, you often do things hurting other people, getting people mad with you, or making enemies through transference without even realizing it. Because it's unconscious, right? But right, once you spend some time, we say, why am I so mad with that person? Or why that person so mad with me? You see, you will do some reflection, soul searching, you usually discover the elements of transference or counter-transference. The counter-transference, okay, let's talk about the boss, also our therapist. A therapist can do two things incorrectly. One is transference, and unwittingly fall in the trap set up by the client and play the role to meet the other person's emotional need. Play the role of a lover, play the role of a father, play the role of whatever. Okay? Unconsciously, it falls into the trap. They call counter-transference because it's in reaction to, it's the result of a transference. So in other words, this person identified with what projected onto him. You can also call that projective identification. Right? You identify what is projected onto him. But the therapy can also be guilty of transference. For example, if the therapist has unmet emotional need, whether he's married or not married, if he has an emotional need that's not met, and then lo and behold, it becomes a client with pretty, with very tender, and like look his dream woman, okay? He said, looks like the therapist dream woman, okay? So now, the client may not paying attention to the therapist, because she's happy to marry, whatever. Right? The problem occurs when the therapist began to look forward to the visit of the therapist, okay? If look forward for the client, okay? If that client coming late, he get very anxious. And also, if the client cancel a meeting for some reason, he gets a fit of depression. Now, from that behavior, you know what happened. He has getting emotionally involved with the client, right? So it's normal to like a client, right? But when you get emotionally involved with the client to the point that you cannot function well anymore. You can't think about a client. Your client doesn't show up late. You got all anxious, all depressed. So that therapist better need some therapy. Better bring the case to the supervisor and stop seeing that client. Right? Stop seeing that client. So we're all humans, and we're all subject to transference and counter-transference. So that's Freud's contribution. And whenever you're making a compulsive and thinking responses, that indicating that you are doing transference. Freud, yes.
Sorry, just a question. So when you talk about, if you have a client that doesn't show up, and is it just that your emotional reaction is out of line with that? Because I have clients that are very regular, right? So if they're like 15 minutes late, I kind of get in my head, oh, I wonder, like I don't necessarily have a depression or an anxious feeling, but just like I wonder what's happened because of their consistency, right? And so it would be like, I wonder what's happened to cause the lateness or to cause the absence, but without that emotional response. So is it just that the emotional response is so, maybe visceral, but just like too much?
No, that's too much. See, what you just said is a normal professional response, right?
Right.
No professional response. But this guy, on top of this guy,
Emotionally.
he can't wait to see the client, okay? So why she didn't show up? She's very disappointed. See that there's very different feeling about concern about her. She's very disappointed.
Okay.
There's a strong emotional,
Mm-hmm. Okay, yeah, that makes sense. Thank
yeah,
you.
because she's emotionally involved.
Yeah.
And she's acting unprofessionally, acting irrationally.
That's the word I was looking for. Like
Irrationally.
Irrational, emotional.
Inappropriately.
Okay.
You're considered professional. What happened? That professional concern, that reality based.
Mm-hmm.
But here, she's not your girlfriend or a lover.
Right.
If she's late, what big deal? Right?
Yeah, yeah.
It's out of proportion.
I find it interesting because very often my supervisor will say, I'm emotionally involved. I am not. And I will say, I am concerned by somebody who cannot get into their car, and it takes them tremendous courage to come here. All the way, they agonize and suffer. I just want to know if they're standing by the side of a roadside and they're okay. They'll come in when they will. And so for me, that's a very humane thing to do, versus somebody telling me that you're emotionally So my sensibility doesn't depend on the client. My responsibility as a therapist are fully accomplished knowing that they're okay. Even if they're on the side of the road, that they're okay. Why did you take a client to her appointment which is 2 blocks away? Well, she was not in shape and I couldn't keep her in the office. I just drove her over to her appointment.
Yeah.
And sometimes clients don't have money. So I find it very interesting as to who says you're emotionally involved. So it would be good if we could get indicators of what indicates emotional involvement, where you've lost where you begin and where the client begins, the enmeshment.
So I'm dedicated, okay, as human beings, there's always emotional part of us, okay? So you react, being a human being, we react everything, not just cognitively, but emotionally. The difference is the intensity, proportionality, appropriateness. I mean, if you're concerned for a client being late, it's based on reality, based on your kindness, there's nothing wrong with that. But the reason for your agitation or depression is because you miss her. You know, that's a totally different story. Do you agree, Josh?
Yes.
See, the guy would understand, right? Steve, you agree with that too, right?
I often ask myself, I'll address that by answering. I often ask myself, you know, is this going to be of service to the client? You know, am I being of service, or is it about my own need? And, you know, if I can objectively identify if it's about my own need, then whatever I'm attempting to do or going to do, I shouldn't be doing. Right? You know what I mean? Like, and you said, like, it's a personal decision because, you know, for some people, service is kind of, you know, it can mean more than another person. And I don't think the response is specific. You know, it's individual, right? You know what I mean? Just ask yourself, are you being of service? You know, or are you being about your own need? And to me, that's the kind of generality that you look at, you know, and if, you know, and then you can't really fail.
And I think, I love those questions you asked, Steve. I think I also am not sure if I trust myself to answer those questions objectively. So that's where I think, you know, bringing in a trusted colleague to be able to give you some feedback about, well, I hear your rationale, however, what about this boundary kind of thing? Because we do, as Dr. Wong said, we're human and we do care, and I think we can kind of take it maybe a bit too far or get caught in some stuff. So
Yeah.
I do like those questions you raised.
I mean, you talk about a support network, right? You know, and then, you know, to me, I also look at, there's an objective reality that's independent of you. You know, like, you know, if, you know, one of the exercises we did in Gestalt was, you know, we did some group work, you know, and then we asked for opinions from the group. And there's a commonality of response, right? And that commonality of response usually indicates what the general truth is there, right? You know, and to me, that's the thing that you look for, right? Independent of yourself, of your own needs, you know, and that's the kind of part that we have to develop as therapists, right?
Okay, thank you. I think Teresa gave us a good example that, you know, all the time we should be aware of the possibility of transferring and counter-transference. If you're not aware of that, you might act without thinking, impulsively, unthinkingly. So that's a danger, okay? Okay, next slide. Reflection, okay? Reflection is one way to protect yourself, okay? You reflect, you know, whether there's anything going on, whether your action is rational, professional, and the reflection also on your own behavior, and check on your blind spots, question your own feeling, the motives toward the client. like Steve just mentioned, you're quite emotive, right? For yourself or for client. So these are necessary for us to keep on track. Do you know that to be a psychoanalyst, you had to go through 5 years of self-analysis? 5 years. You guys, to be a psychotherapist, you don't need to go through that, right? Oh, you need to take a course of this course. This course help you to become more aware, more. That's all they needed, just take one course to be a psychotherapist. For psychoanalysts, 5 years. Why? Why? Because Freud knows that if you have not spent enough time to do self-analysis with the help of a supervisor to explore your vast unconscious region, to really a deep understanding of your own unconscious life, the buried self, it's called the large area, and defense mechanism you have used, the projection you have used, the projective identification you have used. You will not be very effective psychoanalyst. So all you have to do, if you only take one course, there are 5 years. So even after the course, I hope that you will continue to reflect your own behavior. I might behave professionally. Anything I said in the session is all more reflect my own anger, my own feeling, than suitable, helpful to the client. So often, it's some reflection or talk discussion with the supervisor to keep you on track professionally. Sometimes, managing conduct confirmed, Okay, I'm not going to. I'm just. Forget what I forget. I think I've too over 5 minutes. Too complicated. I just basically summarizing it. How to summarize? Number one, your reflection, right? To make sure that your emotional reaction, your feeling, they all should be all designed for the well-being of the client. Not acting out your own anger, your own emotion. Right? Yesterday, somebody asked me about what happens if the client insults you. It doesn't matter. They can call your name, they can insult you, but your response should always be designed to help the client. For example, yellow means an essential therapist. In one occasion, the client was very mad, very rude to him. Guess how he will respond. You know how he respond? He said, I know you are very angry with me. Acknowledging, you are very angry with me. And maybe you have reason to be angry with me. But remember, we have made an agreement that we don't hurt each other. It's like a play therapy, we don't hurt each other. And what you said really hurt my feelings. Now, he's not reacting in anger, right? He's seeing the fact that the insult from saying hurt my feeling, that will make my job more difficult, make me more difficult to be helpful to you. So that will help the client realize, oh, maybe I shouldn't yell at the therapist. So the key, you have to keep everything, keep the therapeutic conversation at the conscious level. It doesn't mean that there's no emotion involved, but the emotion cannot be out of control. The second thing is that the boundary. Okay? If you discover you cannot maintain a boundary, you better discontinue the relationship. Most of the time, if you're able to maintain a boundary and continue to show give professional help, and use the transference as the material to work on, and then the transference can be beneficial for the client to improve. It's not, transference doesn't have to be a bad thing. I mean, it happens all the time, but it has to be managed properly. So you be a professional, you are mature, you maintain a boundary, and not being affected, not play along with the client, fall in the trap, and then you can help the person. On the other hand, if you can no longer function, you're being affected emotionally, either emotionally attracted to the client or emotionally repelled by the client. You can't stand her. It's time to have somebody else stepping in. You step out. Okay? So this, I think, maybe after our lunch, after multiple choice questions, maybe I'll type it out. I'll type it out at the test here. There's a test at lunch.
Can we collaborate on the test?
Oh yeah. Of course. Yeah, or the whole group collaborated. I'll type it out. I'll test it out.
I'm very excited for
Sandra, on the floor. Your work here is done.
Gary, Patty, Donna, this ends part one. I'm going to end the broadcast and I'll send a new link for the second part of the day. And you can sign in like you did before. Thanks.
Yeah. You come back. You're on a break. Are you waiting to do your exam?
Those test questions are from this paper, which will be sent to you in your mailbox. In fact, there's one required reading for each lecture. So we'll be sent to you, okay, to the mailbox. So I would like you to answer the questions yourself, and then I'll give you the answer to see how many get it right, okay? So try to answer the question by yourself. Let's do question number one. Just write down your answers, okay? Then we'll discuss it.
Can there only be one?
Could be all four right, all four wrong. It's not just one, okay? It's not a typical multiple choice.
A and B.
Good question. Sorry that I didn't explain to you. Could be more than one right. Could be more than one wrong.
For sure, it's not conscious process of brain. Mostly
Which,
related to
yeah,
previous part.
you're doing right.
Oh, sorry.
And it clears me.
So when then I'll go to question 2. Are you done yet?
Yeah. Yeah.
And then, so now go to question 2 now. How am I going to answer?
I don't know yet. I don't think there's a right answer.
You write down there, now give the answer, then check how many right, how many wrong.
I think collaborative.
Collaborate. What do you think? I think C is right. The rest
But
are
after
wrong.
then we discuss what is correct, okay? You do it yourself first.
Oh, I can't just go, okay.
Do myself first.
It's okay, guys. Well, do you have 2 pups in a string?
Do myself, then we discuss why is it quite wrong on that. At least do yourself first. So you mark yourself, right? How many right again. So are you ready to number 3?
Mm-hmm.
I love it.
Are you ready for number 4?
You have to go back one. Yeah.
One question missing. Are you ready for the next one?
Yep.
Okay. Right there. Okay, so let's go back to the first question. Okay. Is A correct for most people? Correct? Yeah.
Yes.
Is B correct for most people?
No. It's not always good. It's not always good parents. It can be, but it's not always.
Good.
Always related.
Good. That's very good. That's tricky, huh?
Yeah.
That's tricky.
Try to trick us.
Always, huh? Not always. Very good. I have difficulty figuring out whether it's right or wrong. Number 3?
Yes.
Good. Number D?
Yes.
But not always.
Not always.
It's often.
Yeah.
All right, correct. Often. Yes. Oh, very good, eh? Very good. This. Okay, next question is A.
No.
Good. Oh, you're so smart, eh? B.
No.
Good. C.
Maybe.
Yeah.
Often.
Could very well be.
Good. Correct. D.
Yep.
No.
Well, you're sharp, eh? Oh, well, you can do very well, eh? Next question. Okay. A.
No. It depends on the therapist.
Good. Okay. No. Correct. B.
Yes.
Good. C.
No.
Good. You guys are smart. D.
Yes.
Good. Well, you congratulate yourself, eh? A. Yes.
Yeah.
Not like vulnerable, do steady, your clients. B.
Absolutely.
Huh?
Yes.
C.
What is the meaning of recognizing the importance of federation?
I would say that.
Of course, yeah. I mean, you should recognize, make sure the relationship is maintained, it's not damaged, okay?
Yeah.
You should not let the transference ruin that, okay? Because when the relationship is gone, then there's nothing much left. Because the key is based on therapeutic relationship, right?
Mm-hmm.
So the answer is D. D.
No. Yeah.
Okay, you're right. Okay, last question now.
Yes.
Yes. Okay. B.
Yes.
Okay. C.
Should be.
Should be. Probably should.
Was, right?
Should.
You don't have to. That's good. You doesn't help the client quite tell you, I'll mess up and I'll just problems. It doesn't help, right? D.
Yes.
Very good. You got an A. Everybody got an A.
We were listening, honestly. We were listening.
I know, yeah. But this stuff is real. I mean, even for me, after teaching this so many years, I'm still kind of able to explain it clearly. It's a complicated stuff. We can read it. That's that your mind do trick on you. That everybody has a hidden agenda. You know, are you playing game with me? What you're up to? Make everybody paranoid, right? You know, it's better that no one is talking to you straight. You know, they all have some kind of covert hidden agenda there. It's really scary. Are you playing game with me? Okay, my wife trying to teach now. So I'm done for the day.
Thank you.
See you tomorrow.
Next weekend.
I'll prepare for tomorrow.
Oh.
I make sure to fall. Where's my wife? She's hiding somewhere.
She's momentarily occupied.
She's indisposed?
She's indisposed.
She's short break.
My mother always used to say.
So we have one or two other questions. Can you switch? Maybe.
I'll just scream. I realize my own characteristics, and I think I overstep my boundary. I'm supposed to stand behind the edge of the rug, and this tendency of getting close to people that got me into trouble. And also, I don't know about you, because I find myself have a tendency of ADHD. How many people could identify with that? Yay, good. ADHD is not a handicap. It is an advantage. That means you got energy. You could focus on different things at the same time, right? But it is a disaster in the classroom for teachers. And I thought, if I ever was in a classroom, a rigid classroom, I'm sure they would ask my parents to give me Ritalin. And that will probably put me to sleep. And at this time, after your lunch and after the quiz, I'm so glad there was a quiz. It kind of wakes you up a little bit. But sometimes, like when you have clients all day from, say, 9 o'clock, you don't finish until 5 o'clock. How do you feel? You're exhausted. Yeah. So how many clients do you in general see on one day?
5, 6.
3, let's say, how many have more than 3? All of you. More than 4, more than 5. Some days are 5. What was the maximum client that you have seen?
6, 7.
7. You know what? That is a number I got all the time. I have seen 7 clients. And I usually tell my students, make sure you don't put 2 depressed clients at the same time. Always have one that is lighter, that something is easier. But every case, it doesn't matter. They don't care how tired you are, how many clients you have seen. They come here, they want the best of you. They always bring in the worst of themselves. So you are the healer. You are the facilitator. You are whatever they project onto you, and you just have to be there for yourself. And this is why it's so important And we've got to realize how important is our job, how demanding is our job, and we need self-care. Now, on the syllabus there, but I think I'm going to add one section of self-care so that we can share among ourselves in group discussion under those circumstances. How do I care about myself? But you could structure it in such a way that say I could only take 3 clients from 9 to 12. Okay, that's only 3 hours, right? And then I had an hour for lunch, and I could take 3 more in the afternoon, or only 2. So you've got to negotiate with your clinic or your organization. You see, to be effective, I could only do 3. But of course, if you just do career counseling, well, they think you could just pass them out like hotcakes, right? So this is the thing that we wanted to talk about: self-care and also who you are, and know your own limitations. And early professionals, they usually come out and say, oh, my 10 o'clock client's already here, and I'm not quite ready. And they're here 9:45. I said, your contract is you're going to see them at 10 o'clock. All right, they are here for 15 minutes. You don't have to bring them into your room. They are there in the waiting room. You finish your report. You go out for fresh air, and you do some stretching if you need to. So that is self-care. And I think this is so important. And I bring this up because when we talk about cultural selves, different cultural clients will have different expectations. And also different people who have a different personality, they have different needs, so they wanted you to meet their needs. So you have to realize that you have needs yourself, and you also need to fulfill the needs of others. So this is why it's so complicated when you talk about cross-cultural counseling. Now, I always said behaviors are a product of 3 things. 1, genetics, personality characteristics, and those are genetically ingrained, inborn. And you have that, the clients have that. Could we change it? We could modify behavior by knowing, that what would hinder or what would facilitate, those makeups. But it's also environment. And you have to understand where these people are coming from in their environment. What kind of environment are we talking about? Learning environment, home environment, working environment, and social environment. It's very complex, isn't it? We could say it so easily, but it involves so much. So you have to understand your clients, where they come from. And the other 3rd factor is learning. What kind of behavior, what kind of reinforcement, what kind of things that they have learned to relate to people or to deal with a particular problem. So there's a lot of things in a behavior. So when you see a client, they behave such and such, to you it's that, oh my goodness, here's a puzzle. I have to solve this puzzle. And then you started to explore. And it's more important in the cross-cultural area. So what are we talking about when we talk about culture? Okay. I don't think I want to spend too much time on this. What I want to achieve in this lecture, probably it is a very important area that we need to learn. And especially I could see we are from all different cultures. And there's so much we can get out of each other. So we're not going to rush this part, okay? Because we would leave some, we'll start it and we might expand and we might share more next weekend. Is that okay with you? Mm-hmm. Excellent. Yeah. And so what I wanted to cover would be, we need to learn how to deal with multicultural issues. So we need to be competent. Now, this word really bothers me. we always talk about we practice within our area of competence. Yeah, right. And then we got to be competent in this, we're competent in that. As if there is a box, you learn all these tricks, you're competent. No, our society changes all the time. Our culture changes all the time. And our environment and our, exposure also change. Therefore, your competence would be at this time, at this point in time, facing this particular problem, and this is why I think I can do it. But then when the client brought something else and it kind of challenged your sense of competency, and I said, uh-oh. And be honest, be humble. You learn, you always say, well, yeah, I come to learn from you. Like you come here and say, I want to learn from you, the Wongs. No, the Wongs learn from you too, right? And in knowledge, in learning, is two ways communication and learning. So this is why I say it's so important that we don't say, I am already competent, I've got everything. No, you don't. You still have a long way to go. But at this time point in time, and this problem, I have dealt with it, and that's it.
When you're seeing someone to
see progress in your client.
Yeah.
You see progress. You see growth. You see a smile on somebody's face when they came in with sad faces, right? And that is sad. But we don't wait until 8 sessions away to see that smile. We must see the smile when the client comes in your door, in your room. When they leave, they must feel better before they go. And that is our goal, right? But then when we talk about so many problems that they carry in, how can we do that? So we have to set doable goals. Somebody said, I'm depressed. Could you help me? I said, yes, we could work together. We could help. I think I could help you, but you had to work with me, and you had to be patient with me, and we work. So it's one step at a time. And more so if you are a cross-cultural client, because you have to learn their culture. You have to learn the way they think, the way they interact, and the way they react to you. So this is why there are a lot of face-to-face adjustment the first few sessions. And don't be discouraged. Something, you feel overwhelmed. We feel overwhelmed all the time, but we learn to manage it, right? And so this is why humility is very important. And then we talk about what is the meaning of culture and cultural, turn this off. Yeah, cultural identity. Who are you culturally? Who am I culturally? Have you ever thought about this? You have. Good, good. Have you written anything about this? Have you told anybody about this? Some have and some are not. Mm-hmm. So sometimes it is nice to affirm oneself and make you feel good about your identity, but not always, kind of, no. Sometimes you say, I wish I'm not, right? Mm-hmm. And my son, when he was in grade 2, was, Mom, I wish I'm white. And I said, why do you want to be white? Because all my friends are white, right? And so after my niece came home from kindergarten, I said, Lilian, happened to be my school too. I said, Lilian, what am I? I said, you are Jennifer. No. People told me I am not white and I am not Chinese. What am I? It's hard when you talk about, racial identity. Who am I? And that is a very, very complex concept for children to comprehend. And then to accept In my family, from my mother's generation, my grandparents came here in 1896. Okay, both my parents were born in Toronto. My mother was born in the Jewish area, you know, the Jewish market downtown, and my father was close to Parkdale. You could see his grade 4 or 5 class picture, the only Chinese boy, you know. And my mother's older brother married a white woman. So my cousins is half-half. And she had a hard time being part Chinese. So, I mean, people talk about discrimination. I said, you really don't know what discrimination is. And it's so much more accepting because our society had been more multicultural, more diverse. When I went to Riverdale, we were the only Chinese family with 2 Japanese families. 50 years anniversary, I went visited. I couldn't find a blonde hair, blue eyes among all the pictures on the wall. They were all, you know, Italian, Greek, Chinese, Korean. You see, we had changed a lot. So this is why we are at the edge of multiculturalism. And nobody would even ask. Now, I was one of the lucky ones to marry a Chinese guy. My brothers married white. And then our, you know, like my nieces, nephews, they are, you know, mixed. And then my nieces, one married to a Ghanaian, and she's got a baby that's gorgeous, all get out. And then we have, you know, my nephew who's half Chinese, half white, married a white woman, and then their children are more, you know, are more white, and yet you have one that looks Chinese. And then when you say we are siblings, how come you look different? You see, there are so many variations of mixing in our genetics. So how do you work with clients who hate to be who they are? Isn't that interesting? And not only the look, not only the genes, but the way they were raised. My daughter-in-law is Korean. She came at Christmas time. She said, Lilian, could you teach Penelope a jingle in Chinese? And black sheep, no, that isn't the Chinese. Everything I thought about, I don't know. I phoned my sisters. Do you have any Chinese jingles? And nobody really. So then my bookkeeper, she's Chinese, she said, I can write you some. I said, writing to me is not going to be good. You got to dictate it to me and train me so that I can train my granddaughter. You see, culturally, we have gone so far that we've forgotten where we come from. However, in a majority society, they look at you, what is the first thing they see? Skin color. As soon as they see the color, you are different. Somehow, when we want to make relationship, we are looking for similarities. We are trying to make the differences more important than it is necessary. And so, with that background, how do we share people? You don't sit there, I did not tell you about my background, where I'm coming from, and all that, right? Because I don't see the need for it. But I'm sure in the back of your mind, somewhere in the subconscious, under the conscious level, you will wonder, I wonder if she speaks Chinese, you know? I wonder if they speak Mandarin or Cantonese. Yes, I see ni hao, that's as far as I would go in Mandarin. Right? Cantonese I manage a bit, but my husband will say sometimes, they say, I answer, you know, very bravely, you know, answer, and then he'll put me, that's not what he meant. That make me feel, oh, what did I? You see, you kind of use closure in your language, right? You understand this word, that word, and you assume that's what they ask you for, so you just answer, right? And somebody will know that, that's not what. All right. So it's kind of discouraging, isn't it? So it is good to be open and tell them, I know this, I don't know this, I'm sorry, because you're going to be relating to your clients at the level that is more than normal friendship. It's not friendship. It's a genuine relationship that you can share life experiences, help them, and they can share with you. And by not even nonverbal, they can learn from you. Now that sounds abstract, but anybody from the energy camp, it is real. But in the more theoretical, evidence-based, that is not quite, but it does. You transmit your care by just your look, by just your smile, by just being comfortable with yourself. And you notice, even when you train dogs and cats, when you're tense, they go like this, And human is more sensitive, which sometimes we ignore. But we can't afford to ignore if you are a trained therapist. You could see your client's comfort level. And then also you have to manage yourself in a comfortable way so that they can feel that you are comfortable, so they increase their level of comfort with you. And that is so nebulous, but it is so important, and it is so real. So that's why I'm just talking about the cultural identity. And my friend Paul Peterson, and he used to be at the University of Hawaii. Now he's back in Missouri. So he coined the word unintentional racism. You see, a lot of what I just mentioned is unintentional. They are not going to say, I discriminate against you because you have something different from me. No, it's just so natural. It's just, I don't know. You think animals could always gravitate towards their own kind? I think they do.
Yes.
And also we were at lunch, we talked about sometimes you kind of right away you relate. So I think when there are differences, and that kind of block the channel of natural relating. And you can't, you can't blame them, and you shouldn't feel guilty, and you don't have to apologize. And I always said, we can never eliminate discrimination. Agree with me?
Yeah.
If it's not for color, it would be
Religion,
gender or
religion,
age, yes, so many things, right? Economic status, jobs. This is a good exercise. If I ask you to say who you are, introduce yourself, who you are. You say your name, what would be the next thing you would say?
What are you from?
Well, right now, because it's more of a professional thing, I relate to my profession.
Right. And this is because of the environment, and you see your situation. That's why your identity is not always fixed, is it? And it's always depending on the environment where you were being part of it.
You're absolutely right, because I don't know about you guys, like I said, I'm Polish, and I'm not very, very long time in Canada, but if I am in this kind of group, and I introduce myself, I'm going to say my name, and I'm going to say I'm Polish. So excuse my English, it's not perfect and probably never will be. But if I am with Polish people and I introduce myself, I'm going to say my name and I'm going to say what I do.
Yeah.
So there is and I just realized that the moment when you were saying that switching how we act depends of where we are.
Exactly. And we have to be all men, what was that? To all men. We have to be who we are to all men. But then we have to shape it in such a way without offending.
Yeah, but even then, we're doing this unconsciously. At least I do.
Exactly, exactly.
Because I don't pay attention to it. I just say that.
So how do we overcome? Sometimes when we find ourselves in a awkward situation, and how do we overcome that? You know, for example, if people say, okay, we are not educated, you are educated, right away you see the gap, right? Mm-hmm. How do you overcome that? You can, if they ask you, you have to say it honestly. But if that will create a distance between you and the person, how would you manage it and without a broken relationship or awkwardness or having some kind of invisible barrier?
And try to find common grounds, like their interests.
Mm-hmm.
In some ways, I think even not knowing how we could, I like purple too. So that would be a common ground, right? So I guess finding something that will sort of break that barrier.
Mm-hmm. You see, barriers are created by our head, right? Yeah. And we are smart people. We always learn how to navigate through that. And I always say in my card, it said, who you are is more important than what you say, right? In other words, you've got to build your own character. You've got to be comfortable with who you are. And you want to be comfortable with other people, and you've got to be very honest. But how can we get there? I think therapists are much further along than most people, or I don't want to name some other professions because they take me. You know, in some profession, you just want business, right? You negotiate, right? And you get the maximum amount or negotiate contract. And I mean, yeah, that's okay. I don't care who you are, but that contract you got to sign. But in our human industry, we have to be who we are and genuinely be happy with who we are, right? In order to do that, we need to do a lot of reflection, don't we? That's why when Paul was talking about transference, counter-transference, and I had a lot of notes, and I say, yeah, this is what we all need to do. It doesn't matter how long you've been in the business, but once in a while, you've got to wake yourself up. You've got to say, hey, Lilian, that isn't right. You know? And so this is why I always advocate group peer supervision. And don't practice. For those who are in private practice, find someone you can share. Because if it's a lonely world if you're going to practice on your own. What do you do, right? So you always need to connect. And I hope these classes will facilitate that. You get to know one another, you could call on one another, and that would be really nice and helpful. And what's microaggression? Anybody heard about that? Yeah. Okay, could you give me an example? Was I told you one?
Okay, I can give an example. So microaggression might be if, let's say a boss is male and he maybe subconsciously doesn't respect women as much. When he's looking at people looking for responses, he's looking at the men and discounting them.
And sometimes the word came out. That was what they learned in childhood. And they never realized it was very derogatory. And that, and then when you see somebody like that, right away you throw that word out. That is microaggression, isn't it? You say something to satisfy your own discomfort, the sense of discrimination or anger, and how come you are here and you shouldn't be here, back to your home country, that type of thing. And that's microaggression, isn't it? You don't have to hit them in the nose. So sometimes these things will prevent us to connect with our clients. And also we talk about awareness of cultural differences that we have talked about, and also what do we mean by individualistic society, collectivistic society, and how do we identify those? Yes.
In that when the culture is very much, we're part of the same community, when it's collective, we're part of the same community, our services are about me supporting you and you supporting me, it's kind of a we thing. And then another culture, on the other hand, may be more about you need to do what you need to do to be successful. It's much more, individual.
So we're going to talk a little more about
the
this.
me rather than the we.
Right. And then we talk about self-disclosure in cross-culture. Some people demand that you answer the questions. How are you going to deal with that? They will say, okay, and how about you? We challenge you so that you are listening to me. I want to know a little bit about you. So shall we or shall we not? We were just talking about self-disclosure has to be for the benefit of the client. But if the client wanted more than you wish to share, all of a sudden you say, I don't want to tell you, right? Do we have the right not to? And how do we say it without offending, without building the barrier that it wasn't there before? You see, so dealing with people is a very delicate process. And if you are not sensitive to other people's feelings, and you're not going to be a good therapist. But if you're overly sensitive, then you cannot control yourself, and you're not very effective. So you are not in a win situation, right? I have a student who wanted me to recommend him for a PhD in counseling psychology. And I looked at him and I said, do you like people? And I know that he doesn't talk to people. He doesn't like people. He said 7 years in undergrad, I only met one friend. And I said, you know what? I don't think at this time I could recommend you until you prove to me that you are comfortable with people, but find out what you can do best. It's very good, very successful in the IT world. You see, sometimes it is for their good. They think their friends were in this, or maybe they have a sense of that, oh, I want to help people. This is the profession I should get to. But as a counselor, sometimes you need to say something that is true, to be honest. Sometimes it may not be well received at that moment, but it is on the long term. This is why it is so important that we are not hindrance for the growth of our clients. And this is why we need to soul searching. And there are guidelines at APA. I've got some slides on that one. Okay. Now it's Paul Peterson who called the cross-cultural psychology as the fourth force of the mainstream psychology. What are the other three? Peterson, Paul Peterson, P-E-T-E-R. Yeah.
Just hearing in pen. Thank you for clarifying.
What are the other three? What's the very first major areas of psychology? The very first one invented by, started with Freud, psychoanalysis. Okay? And what's the second one? To counteract that? Behavioral. Okay, what is the third one? humanistic, existential, and then cross. Now, as I said, our society has become so increasingly multicultural, and without that, will hinder our relationship with our clients. And now, APA, American Psychological Association, required that you understand the multicultural guidelines so that you will not hurt your clients. And this, I hate to say that sometimes these are very political, but it is necessary. But we should go beyond that, not just because of the guideline, but because it's for the good of our client and for the good of their society. Yeah, Sue Arredondo and McDavis, and they said, to Bill, what do we, how, you know, like, when you just talk about how complex this area is, then how can we conceptualize it in such a way that we have a framework to work with? So they started to say, okay, self-awareness, that is very important. You got to actively become aware of your own values, your biases, and your assumptions. Some people say, I do not have any bias about anybody. My heart is as wide as the ocean. Okay, come on, be realistic. Right? We all have those, you know, things that we like, things that we don't like, how do we interact awkwardly. So we do have that. So we've got to start thinking about what are my biases? It's so easy. It's so easy. It depends on where you were brought up. I'm sure when my dad was brought up in Parkdale, I'm sure people looked at him and said, you are Chinese, right? And he said, no. You know, this is funny. If you are a minority, you live in a majority society, and you work with majority, and you forget about your own identity. And Elizabeth and I were twins in undergrad. We were going to cafeterias together, library together, fun, everything together. One day I was ill, and Elizabeth was by herself, and a friend would come in and say, Elizabeth, where's your Chinese friend? And Elizabeth said, who? I mean, this is life, right? Every day. I don't think myself as Chinese because I was with all these blonde-eyed, blonde hair, blue eyes, everything else, and all of a sudden I realized I was different when I look in the mirror, right? So this is why when we're talking about discrimination biases, we have to give, you know, a lot of leeway. Why? Under what condition? And is it important to emphasize the differences? More importantly, to emphasize the commonalities than to emphasize differences. I think if we emphasize differences, we build more and more barriers. And understanding the client's worldview and attitudes and beliefs. How can we do that?
Lilian, earlier you were talking about your nieces and nephews and what they look like, right? I was thinking to myself that sometimes what we think we see is not how that person identifies, right? So you can see somebody who comes into your office, they look white, but their parents are, one of the parents are Trinidadian or something, right? So they might not identify that way, or the person might look black and they're part Chinese, you know? So you don't really know. You think you see that, right?
Exactly. Isn't that amazing? But we are all created uniquely in the image of God. We are all should be respected. And we all should be, you know, I don't know, I just find that human beings have the dignity. They are unique. We are all unique. And you never know where your ancestors come from. You might even have some Chinese blood, Mongolian
the coast of Madagascar. And when my mom was visiting, we do have, the food that we eat is Indian. It's a mix of Indian and African and Chinese. And so I went to the Sri Lankan part of town to run in and buy some groceries. And the grocer that I was at, he spoke to me in Tamil, whatever the language is. And I said, oh, I'm sorry, I don't speak your language. And he took such offense. He actually put all my stuff on the counter, and he went to the back of the store and he served me. Oh. And I know nothing about the Sri Lankan background. I'm not. Yes. I'm like, yeah, I'm not Sri Lankan, and it's the color and the look, I guess, just fits the type, and just to add to
exactly.
your comment. Yeah.
So our looks, create barriers. So as therapists, we need to overcome, because I'm sure in our back of mind, we do have that barrier. When somebody comes in and it looks different, and right away in the back of your mind, I wonder what background he or he is coming from, right? I wonder what language is that. And right away we kind of calculate the differences. And it is through relationship that we are all one. We have our same emotion. As I always say, we are made of the same stuff. We are psycho, the cognitive part. We are emotional, which is very strong. And we are social. We much be rather together learning, even on webcam, than to be taking a book and reading in your own home. Because we're social beings. We like to share. That's the only way we grow. We learn to relate, and we learn to survive. We learn to live. And then we are spiritual. And unfortunately, our secular, institutions in education and everything else, and they want to take that spiritual part away from us. And this is why sometimes, if you talk about the percentage of depressed young people, children, adolescents, let alone regular and seniors, a lot of them do not have this spiritual aspect that we actually live and depend on. Whether you recognize it or not, it's there. It's innate. You could call it Allah, you could call it Jesus, you could call it Buddha, you could call whatever, someone who's higher than you, and that gives you the power to transform, to change, and to feel good about inside. So when you mention about, people ask, are you a Christian? Because that is an important part in our relationship with others. But it's hard to learn to respect or to understand and to learn other people's beliefs. But we are open enough to say, okay, whatever belief you have, whatever the way you communicate with your higher power, go for it. Do it, as long as it helps you to heal. And somebody would say, well, how would you do it? I said, well, I pray, right? I get somebody else to pray for me because I believe in that, and I read the Bible. So, you can do it without being obtrusive, without being saying, I am right and you are wrong. And you never know, because we are created by one. If I believe in, one God, by the universe, right? So I feel comfortable with that. But you get all that questions, and you also have to think about yourself. But it would be very hard if you see, I know so little about the Asian culture and how they burn things and incense and food and all this. But then if that makes them feel better, that's their habit, right? So even though I don't know whether it was right or wrong, and it might make me feel kind of, but it's okay. So this is why we should not deny our own feelings at the expense of our job. We've got to respect ourselves, and we've got to explore. Some part of ourselves are constructive, relating to people, relating to the job that we do, but some are destructive that we've got to overcome. If we learn how to overcome those negative feelings, and naturally you could help your client, even without point 1, point 2, point 3, this is the program. Somehow you exude that kind of confidence that you can help yourself and you learn from yourself. And of course, sensitivity. Now that is the part that we would have to develop appropriate interventions. Now Sue, this is Stanley Sue. We have 3 Sues, Sue, Stanley Sue, Sue, and who else? And they're all in cross-cultural. I really admire Sue. When we started, it wasn't easy to talk about cross-cultural psychology. They stick the neck out, and with populism and everybody else, you know, they were good. And every time we go to APA, you know, to get to know them and interact. And I'm going to do a little bit of commercial here. How many people will want to go to APA? It's going to be in Toronto this year, okay? We were in Washington, D.C. last year, was it? Yeah. So, you'll be going? Absolutely. Absolutely. So you don't have to fly, right? You don't even have to book a hotel, right? And usually we have about 12,000 people. And we take over the whole downtown hotels and even restaurants. If you don't get there early enough, you don't even find a seat. And also there are so many things going on. And I'll be, again, very active in the supervision and training section of Division 17, that is counseling psychology. And Paul is very involved in the Division 32, humanistic existential. So we're very active. We have roundtables, we have speed mentoring, we have all sorts of things. So I'm going to send you some of that info if you're interested. Because, I mean, why should we be practicing in a little pocket of North York or of TGA when the world is coming to us? And if we do not take advantage of that, right? Of course, you are a student or you are intern or whatever, you get the student rate. And if you are a practitioner, you could get that as an exemption, some tax deduction or whatever. So be part of the larger community and learn more, okay? And immerse yourself in it. Okay, beliefs, attitude, knowledge, and skills for all these elements are very important. Are there any questions so far? Yes.
I would like to clarify from my questions is the difference between spirituality and religion, because it constantly poses challenges not only in the therapeutic context, but also the historical mistreatment of certain religions. And if we can do that, then I'll pose another question. I can pose it out now. On the ground, some of us don't use the word multicultural competencies. We will talk about racialized cultural competencies. So if we get a chance, so I listened to this because we saw the evolution of multicultural frameworks evolved from the 70s, 80s. We moved an agenda from those times to cross-cultural counseling, intercultural counseling, to moving back to race awareness, racially aware counseling, to anti-racist counseling, and then to say that everything is racialized. So culture is racialized too. That's a discourse that is going on in the service sector, where we move these agendas. And I'm sure it will have the lens because I saw the. And the question is, how do we integrate it as an entry point?
And this is what I mean by, whatever you learn, it's not going to be fixed. Society is changing, moving, and always depending who's the leader of that group. And, you're right. we have changed a lot of terms. But basically, we're still dealing with the same thing.
True. True. But there is a constant battle about commonalities by itself has not produced the change that we have sought for. And actually, we subordinated our differences to move a national agenda. And then nothing changed for workers and clients and services that will be other. So we, as women of color, start with an Aboriginal woman, Black women, started moving a discourse of difference. So there's some historical stuff, but I am enjoying listening to these things and also reflecting to where we are and where we are going, because you can always revisit where you came from all the time as a reference point to say if what you're doing is currently have currency or not, or relevance. So going back became a commentary just for some people in terms of what we have gone through is those are two different things in my mindset.
Spirituality and religion, yes, definitely.
And especially if we are looking at a holistic notion of
Exactly, exactly. I'll be doing a seminar at APA on spirituality and religion, and apply in supervision. And I think it is the second day. I have to look at my calendar. Yeah. So, yeah. August 6th to 9th. Very good. I'm glad. All right. Let's just move on. I like that definition. Is it too far for you to see it? Some of okay. Yeah, I usually like, 34, 36 points so that you can see it. You know what? I always get off the topic. Paul said, focus, focus. I'm just thinking, would it be easier next weekend I move the chairs closer to the front? Because this is almost like very, artificially. It's a nice carpet you could sit on, right? So, anyway. Okay, I will read that for you. Culture is a human-made environment. Agree? Yes. Culture is a catch-all term referring to a collection of both symbolic, we were talking about that a minute ago, language and religion. Right? That's all part of culture. And material creation, which meals, buildings. Why do we go to a Vietnamese restaurant? Because you have the Vietnamese distinctive dishes that we like, right? Why do people go to a Chinese restaurant? That's culture, isn't it? Yeah. And we got so multicultural, we've forgotten it. Where do we go? Well, Asian legend. Because we like the food. But why do you like the food? Because I like that culture of food. And I like the change of culture food. I want to go to Pickle Barrels because I do want to, worlds. So I think that's part of culture. We never thought about that, but when you think about it, it is very essential because when you talk about the client, they bring lunch in and they have this curry. And you say, I smell that, right? Is that offensive or is that delicious? You see, so there are so many differences when we are reacting to our five senses. So we have to be aware of those things. And also the buildings and, temples and all that. When you go to Southeast Asia, you see all these different structures, and you think it's an art, but that's the way they live. Culture also refers to social norms. We're going to talk a little more about this. And moral values, and, talk about moral values. This is not moral values, but just disciplinary practices. I said to Paul, why do the Chinese always hit the kids in the head? Have you ever seen that? Every time when they don't behave, they go whack like that. I thought, you think that will hurt them, right? Yeah, I mean, they were not even spanking the ball, but they smacked in the head. I thought, this is so horrible. So, I mean, practices, that's the way you do it. And the kids will all love it. They think this is love, right? When they love the kid, you go whack on the head. That's all culture. So you got to learn about these little gestures, and the nuances. If I were the kindergarten teacher and the kids say, oh, what did that? Oh, my father, whacked me in the head. There's a disclosure of abuse. And that's still out before, right? Phone, the protective social worker, right? But that was the way I loved my kid. But then I said, what is inside the brain when you knock the brain a little bit? I don't know how healthy that would be. But anyways, and also the way of life and what constitutes a good life. That's a big thing, isn't it? What is a good life? If there's a client who come in and say, you know what, Hannah, I got everything, but I don't think I have a good life.
That means because you have a silent align with yourself.
She's got a philosophy. But her philosophy may be different from somebody else's philosophy. Right? So we have so much to learn, but we also have so much we need to change. And we need to understand. Now, my way of a good life may not be a good life for somebody else. So I would have to understand where this person is going to be living, where this person is going to be, for the rest of his 50 years.
And with different views of some, there's going to be the materialistic views of having a good life.
Yes.
For somebody else, it's more into family matter, which they have a good life. They have a good partner, husband, wife, kids, and they fulfill their expectation there. For some other people, it's because they are spiritual and they're having a good life. They grow in their own eyes, and that means for them good life.
Do you have a good life? Think about it. Perfect life. That's good. That is good. And culture influences all aspects of our behaviors more than we realize. Perception, cognition, and behavior. You see, sometimes we don't realize it. And then we thought, how often you look at that person and say, isn't she odd? Isn't he funny? Just because their behavior is a little bit different from our expectation of what the normal person should. And their culture is broader than race and ethnicity. Isn't that critical? And we always talk about, in Vancouver, we talk about East Side. We talk about university, Kitsilano. That's where the university, all these people, educated, and the East Side of the people who are homeless. Same city, same race, right? But different culture. Isn't that
Other
interesting?
side of the track.
Other side of the track, exactly. Diversity. What's the difference between cultural, multicultural differences and cultural diversity? Is there any difference? Tell me.
Diversity covers kind of like a broader, it's a broader circle in a sense. So it can include, culture, but it includes other.
More than culture.
Yeah.
Diversity is more than culture. It's more inclusive. And just like here, sexual orientation, which is not in the culture because it's cross-cultural, right? So that's why we like to talk about our society is very diverse. And we have to learn how to work among the diverse populations. And there are so many shades of cultural differences through mixed marriages and migrations. That's what I talk about. And just look at the refrigerator of mine. And my niece said, hey, talk to her husband, Roland, we made it to the refrigerator. So, anybody knows what that is? Anybody heard about that? One can be a banana. Oh, what is a banana? It's an Asian person born in America. And you could create a few more fruits for different cultures. I'd like to hear about them.
You know, it's funny, like, you just been in Toronto, and, you know, there are persons, like I said, who are from Jamaica, and they've never set foot in Jamaica. Like, they're like, they're born here, they're cultured here, they're Canadian, they're cool, but people see them making assumptions that, oh, you know what it is, oh, you should offer you some. I've never had that. What is that? How can you have that? Well, I don't know, like, you know what I mean? So, and that happens to, well, that certainly happens to me, where people assume because I'm Jamaican, I should, you know, talk like Irish, so they come up to me like, oh, you're Jamaican, oh, Irish. What? I don't say that.
That was even my clients. That they just, it's funny that as we talk about diversity, because with the mixed group of youth I work with, so the Asian kids come up and they're like, are you native? So I'm like, no. You look native. You are native. Okay.
Yes, I
so. Talk about why you think I'm native, you know. And then their parents would visit and they get to meet the kid's social worker and they are like, oh, so you are native. Wow, it's funny. Other kids have said that. I don't know how I connect, but so I'm native here. And then the Caucasian kids I have, the white kids say, you're not Jamaican because you're not black. Mm-hmm. Sorry, I speak English. Oh, you look Spanish? No, I'm not Spanish. So I'm like, okay. This is where diversity is so much, even within that one scope. But one of the things the stereotypes, I call it,
yes,
within the scope of my practice here, is that so all the kids, whether irrespective of their original ethnic group, the stereotype is that once you're Jamaican, then you smoke weed, or you grow it in your backyard. I'm like, do you think I have flower pots? in my ears. And they're like, you never smoke weed? Can I be honest with you? No. What? You're not Jamaican. How come you don't smoke weed? Like, it's legal. You guys just walk around with a blunt. Yeah. We don't even use that term in Jamaica. Right? So I'm like, no, no, but I know Jamaicans here who tell us that it's so legal, you all walk around with it. I'm like, those are kids born here. Some of them have never been to Jamaica. So the stereotype of culture and the diversity.
I like that word, stereotyping.
Yeah.
Mm-hmm. And this is what we do, don't we? Yeah. But that's all right, isn't it?
We're born with a lot.
It is acceptance. When we go to the meaning approach to using self, we will address those questions. That will be great. All right. The therapist's cultural identity can hinder psychotherapy. In what way?
Yeah.
This is
I was
something.
just thinking. Yeah.
This is something I wasn't even aware of until maybe a few years. I'm not consciously aware of, right? And then I started studying cultural diversity and getting groups in that, and I started to realize, wow, it actually is an issue, right? And I just wasn't consciously aware of it. So I kind of agree with what they say here that it's an unconscious thing.
Carry on, Steve.
I think before it becomes unconscious, it's so heavily reinforced in subtle ways and other ways that you develop a notion of confinedness or other blindness. So what happens is by the time you come to the awareness, it's been so normalized. I carried a whole bunch of ICU that I wasn't even aware until I chose to conscientize myself. And I said, I asked my professor one time, who do you see sitting in front of you? She said, a woman. I said, I'm not working with you. And I walked out. This was in university here, okay? As a way of, we teach each other, right? But sometimes we choose what is the easier path. I don't want to see different because I don't want to be associated with something that is historical and has nothing to do with you. And so you have to reflect on your own process because I come from a very privileged class background. And for me, at one point in my life, to say no quota systems for the Harijans of the scheduled class would have been very appropriate. Do I say that now? No. So it's a process where you're desensitized and you resensitize yourself and become a better person. A spiritual person. So welcome.
Sharon.
It's just a comment that I've also noticed. It's like even the children identify it. Like I'll just use an example. As we're at a social gathering at a restaurant, and the girls were out for a movie. So this boy was being babysat by us, and he was not older than 10 years old, but my friend beside me is Korean, and he's not Chinese. But this boy goes, "You're Chinese, aren't you?" He goes, "No, I'm not." And this boy was insisting, he goes, No, you're Chinese. You are Chinese. And my male friend said, "No, I'm not." He wasn't going to say I'm Korean, but he was, "I'm not Chinese." It's point blank. And it was very, very important for the boy to get it right because he was confused, but he wanted to make it an issue, saying, "No, you are Chinese." And then he just highlighted feature. He goes, "I know you're Chinese because you have an accent, you have black hair, you have light colored skin, blah, 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 blah." My friend was really annoyed. If it wasn't a boy, and he goes, I would have smacked him on the back of his head. Really good. So this child, and the male that was babysitting this boy, he just muttered to the boys, was, "You're way out of line." It's hard because it's not your child, and he was under 10, but it was already ingrained in this child. I thought he was, a well-behaved boy. I didn't witness this because somebody switched as soon as I showed up. So I was the only girl in this group, but he was when he was with the boys, he thought he could just let loose and be himself, but he was quite rude, and what we thought as adults was very out of line. So I don't.
That is sad, isn't it? Yeah, among children, especially among children. They don't have the sophistication of, the adults can rationalize and think. Yes, Steve?
Yeah, I think I was just going to speak to your point there that, there's a danger in oversensitizing yourself, right? And then I don't think that helps the situation either, right? Because, it could just be as simple as that child's only understanding of Asian was that all Asians are Chinese, right? It could have been something very simple like that. And kids are literal and honest, and they're like, no, you're Chinese, right? You know what I mean? It's not that, you're Chinese because of coming from a racial place. It's because this is how I see Asian people as being Chinese, period. And so, like I said, to me, there's a danger in kind of swinging too far one way when we talk about, cultural diversity. Because I think then, we can end up, oversensitizing ourselves, and we can limit our ability to kind of interact with the client on a human level, right? Because that ultimately we want to reach people, right, and be able to connect with them.
And you miss the learning.
That's right.
Teaching moment.
Yeah.
Because you're so either trying to deal with being offended, or how should I take this, or are you kidding me? I get the same thing English, and the culture in my family was very different from my next door neighbors, but I think that we miss an opportunity to learn and share. And I think the other thing about kids, they're a really good mirror for how ridiculous adults can be sometimes. They give us back our stuff, don't they? And you go,
the exaggeration of what the adults have been impressing them. And also they talk about Chinese as a category. They didn't know that there's so many people look alike with so many different countries. So everybody's Chinese if you look like this. Yes.
Yeah, I was just gonna say too that it's interesting because my dad is actually from St. Vincent in the Caribbean, and our family is very like I grew up on rice and peas and curry goat and the whole shebang. And you know, people say to me, "No, you're not," and I'm like, "No, I really did." And they're like, "Oh, okay." And then they'll test me. Okay, well, do you know what cuckoo is, or do you know what? So they'll start naming off foods that are, from the island. I'll say yes, and then I tell them the ingredients. And then they finally get to the question. It's like, well, how is that? Like, how come you know all these? And it's like, well, because, and I know they want to ask me, is my dad black? Yeah. The whole thing they want, this is all gearing up to, what color is your dad? So I
observed this going on.
Right? Yeah. And it's funny because Marcia will say something to me like, whatever, how you doing today, or whatever, and then I'll say it back to her, and people go, what did you guys say? And it's like, and then they kind of, okay, so in terms of the banana, somebody said, you're kind of like a reverse Oreo cookie. They're like, well, you're actually white on the inside and black in the middle, like they reversed you, right? So I thought that was a really good example of kind of the reverse Oreo cookie, right? Yeah.
Isn't that funny? What if I give you a piece of paper, ask you to draw yourself into a fruit, into a cookie, and I want to see what you would come up with. Wouldn't that be a good exercise?
Yeah.
Self-identity, right? Creativity and conceptualization. Hey, that would be a good exercise, don't you think, Josh?
Yeah. Great exercise.
I have paper downstairs. That's what I'm going to give to everybody.
Well, I was asked once in an interview if I was a fruit, what sort of fruit would I be?
Really?
Yeah. And at first I'm thinking, okay, I am part of the LGBT community, but I don't think that's what you're asking. And then I went to, so then I thought, well, I got to be somewhat witty. And I thought, well, I'm going to stay away from banana because it's the phallic sort of thing. So then I thought, I know, I'll be a Greek player. So I said, well, I'm really grapes. And then kind of went this whole analogy, but I thought that was the weirdest question I ever got.
What animal would you be?
Yeah,
that's another thing.
Who asked you by any chance European?
What's that?
The person who asked on that interview, by any chance was European.
You know what? I'm not sure.
Because it's very common.
Is that right?
Yes.
Okay, all right. What fruit you would be?
HR went through a period of that, didn't they?
Yeah.
Yes, they did.
Trying to get you to.
I don't know because how would they interpret grapes?
I don't know either. Only the person who drew it can tell you. All right. And this is one thing about interpretation of art. Ask Teresa.
Yes. I was going to say to Lilian is that even with we're talking about, how can our cultural identity hinder psychotherapy, even within our own culture, right? And understanding what it is. For example, I'm Jamaican. I'm actually partly Chinese Jamaican, right? So what does that mean for me? And then meeting another kid who's from here, whose parents are Jamaican. And to me, when I see the way they act, it's so not reflective of who we are.
That's right.
Right? So I think that and my own views of what being Jamaican is, I need to kind of check in with myself to say, okay, what do I see? How do I see these wannabes? That's how I see them. No, you're not really Jamaican. And it's not because you're not. It's just because, I think my generation is a little older than them and different.
Generation gap, individual differences. Yes.
Yeah. One thing, I remember, 8 years ago when I started this particular job. The therapist who was working there before me, he was white, I'm black, and so he had a couple of clients who he was still seeing that he had to pass over to me. And there was this one girl who was black girl from the Caribbean, starting to figure, oh, this one will be easy, kind of thing. And I remember she came into the room and she's like, oh, you're black? And she turns to the guy who was introducing us, and he's like, I do not want to see a black girl. I know. So, I mean, how do you respond to that?
Yes.
But again, that's where wisdom came in. Honestly, that must have been an act of God. But, I didn't react. I just engaged her, and I said, can we talk about that? Because there must be something. When she came back, when she had that perspective, and she saw that I didn't get all, about it, and I really, we talked it through and everything. I mean, she turned out to be, I think you mentioned, like, one of my best clients ever, because her perception of other people from her community was, when it comes to mental health issues and how they saw her, was very negative. Yeah. And so she thought I would see her in that same way, right? And so it was like, and every time she always says to me, you're so different. I'm so glad that I, gave it a shot, because it was different. It was strange for me.
I'm sorry, that word different drives me crazy. I gotta say, it really does, because being a black person, to me, regardless of how much money I have, regardless of what my race is, regardless of my religion, I really just see us as people, right? So to say you see me as any different because I'm educated really rubs me the wrong way. Yeah. That's my own self-disclosure there. There are certain pieces about when, especially if white people say that to me, it irritates me, because you know what? I am a part of a black community. I don't think I'm any different, really. Maybe different from what you expect me to act like.
So our special identity could facilitate, but it could hinder.
Yes.
And the most important thing is we know how to handle ourselves. That's what you did. Well done, because you got her trust and started to work. You're not going to feel, oh, you kind of, look at my face, skin color, and there's a barrier. You just overcome that barrier because you are happy and you're satisfied with yourself. And that is what we need to, because we are all different. I'm sure if we have DNA for all of us, we all are mixed somehow, somewhere. I don't think anybody's pure. Okay? Yes.
Growing up in Windsor, being across in Detroit, when I was young, when I was a child, my father used to bring us downtown Windsor to look over at Detroit in one of the parking garages and watch the race riots. But I didn't know that's what it was. I just saw fires and stuff, and I thought, well, that's nice. Can we go home now? And it wasn't, like, I knew after it was the race riots and stuff, but I remember working with a black woman, and she started sharing with me, I was working in the States, she started sharing with me about her experience growing up during the race riots in downtown Detroit. And at that moment, it hit me. Oh my God. I was there watching this, and you actually experienced it. It was just a totally moving experience for me to have encountered this woman. Yeah, it was just amazing how it got me to change. Yeah.
You see the power of relationship, understanding, and experience. And when I saw this, and I got this paper, okay, and it is Awareness of White Privilege Among White Counseling Trainees by Ansins and Semensky. And, most people are not aware that they have this privilege that they did not earn just because who they are, and they're not aware how other people feel about them, and it becomes a hindrance. So with either your client's white or the counselor's white, and they need to be aware of some of these things that they didn't ask for. And this is a good paper.
I just want to make a comment that in order for relationships to evolve, the tool that we use is language. And the politics of language, they either create a disempowered context in any relationship, including therapeutic relationship, or an empowered context. So we say language is not neutral, right? So, and it could be, our work also, in our work, we say 90% is nonverbal. So both of them have to be congruent, but we have to be very critical because even as Holly was saying about the word fruit, it has a very different meaning. People need to really think who's coming to the table, which words are problematic, and actually I've gone to interviews like that where I, in the middle, decided I don't want to come to this organization. Because if this is how you're going to begin with me, I'm not going to come in here because we spend our lives educating people. Because it's the direction of the earth is always educating the other. So having said that, that's what I do in my work, but I'm just saying it's just to be very cognizant of the language in stated and unstated ways, if our role is to create relationships that are empowering. And in this stage in time, we no longer can say that we are not aware.
Thank you. Okay. All right, and we'll pass our break time. I'll just wrap up with this. The therapist's responsibilities, so that you could think about it. And it said we need to recognize that everyone is a product of cultures, and we are cultural animals. We may unconsciously discriminate against people who are different from us. We often deny that we are bigoted and may be unaware of our biases. And we need to exercise self-reflection to examine our own racial identity. So the exercise would be to draw something that represents you. You could be animal, you could be cookies, you could be a house, you could be anything. Downstairs later. Is that okay? And you could think. Now, I have a couple of announcements. And this is inventory of self. So I will hand it out to you, and for those partners on the webcam, I'm going to email it to you by attachment. And you take time to think. You say, personal trait, my attractive characteristics, my unattractive characteristics. Do I have an attitude towards psychotherapy? Self, towards clients? Do I have any personal issues? Family secrets, personal secrets, hot buttons, emotional issues, area of personal life or practice that may benefit from personal therapy. And then personal knowledge, of course, blind spots and what have you. Have you ever mismanaged transference? What are your biases and jealousies and prejudices? Are you afraid of self-disclosure? And then what are your future plans? So this will wrap up everything that we've said the last 2 days, and we're going to do more the next weekend. But in the meantime, I want you to get started. Some of my previous students said, it took me 4 hours. I said, good. That is cleansing, that's reflection, that is growth. Do it, you know. And then if you got it all done next weekend and you say, I'm going to change something, and you could. And I don't ask this back until the course is finished. I'm going to give you 2 weeks after that to hand it in before we give you your certificate. Is that okay? Any questions? All right. And you have 20 minutes until 3 o'clock. Is that okay? And stretch and do exercises, get music. I don't care. Just be comfortable.
Yeah.
Yeah. I'm so sorry. I got to do something about this. All right. And you know what I have learned? How to breathe. When you are tired, how many people know how to take a deep breath and relax? Ah, okay, tell me, how would you do it?
Usually, I step outside.
Ah, okay.
And there is a nice curve, which I'm going to sit down.
When you're going to stretch, you're going to do something.
Yeah.
But Dr. Willis on TV, I don't know whether it works or not, he has a formula of 4, 7, and 8. And he said if you, before you get out of bed, breathe 3 or 4 times, get the oxygens in your body on before you go to sleep. And it really helped. So I have trouble with the 7. What it means is that 4 is breathing in through your nose, hold it, count 4, 7, and blow out 8 so that you see you are doing the diaphragm breathing. Last one, number 3. Isn't that good? Oh, so good. When we were in Taiwan, I have to go back to
Today you were in a box.
we had about 400 people in the auditorium. And after a whole morning post lecture, and after lunch, they're all falling asleep, right? That should be. So I asked the congregation, the audience, anybody know how to do stretching exercises? So there's a professional person who came up, and they had a huge stage, and I took a picture of that. It was so beautiful. You get it's got universities, and you've got the Fuguang, you know, the Buddhist university, and in the front rows you get these nuns in their habits, and then you have this priest and all the monks, and they all go like this. It was so beautiful, just lovely. And after that, I could shake it all out, and then they're all ready for the next lecture, 3 hours long. All right, we have 55 minutes, and we're going to do some integration of what you have learned, and also to process some of the things that you have taken in that you haven't had a chance to do it individually. So I told you about that picture. I do have papers, I'm a crayon, whatever. I'm going to ask you to do that at the very end. And before that, Teresa, I have, out of the goodness of her heart, she's going to design an exercise and for us. So it's a mystery. I don't know anything what she's doing, but I assume it's going to be safe and effective. Okay? Safe and effective. Okay. And she's going to give you some instructions.
Okay, just a little preliminary. Oh, okay. A little preliminary of what we will be doing later on when we go downstairs. Okay, you will see a sand tray. Okay, and then each one of you here, this is wrapped up in a presents look like. However, you cannot take it home because they belong to the playroom from Dr. Wong there. So when you finish with this, just leave it whatever they are on the sand tray, okay? When you unwrap them, okay, from a figurine, they're all figurines in here, okay? When you unwrap them from the figurine, they become a symbol to the person who's holding it exclusively, okay? However you see the symbol to you, that's what it is. So if you look at the other person's figurine, because it's not your symbol, there might be a so-called universal understanding or stereotypical understanding of the particular figurine. But that's your own business, okay? Because that person might not choose what that understanding as their symbol. So just be mindful of that. Okay, so I have no idea which figurine you're going to be picking and how you're going to use it as your symbol. So once you do that, take your turn and then place it inside the sand tray. Okay? And you can mold the sand, you can move the sand, and when you finish it, the other person put another one in there. It will become like a collective, like a community art. Okay, and then I will let you know what the next step is. All right, shall we go downstairs? Oh, I forgot housekeeping. One more thing. Those of you who have been sitting all day, hello, I'm back. I don't even know whom I'm looking at, except you guys, right? There are some chairs set up. So those of you who just wanted to sit on the comfortable on the floor there with the carpet is fine. And those of you who are more comfortable with the chairs, then by all means. But they don't have this exact same number of chairs as you have now. So just keep that in mind. Okay? All right.
Bring some chairs downstairs.
That's it. You will be doing all right?
How many steps?
Okay.
How many steps?
How many steps?
There's quite a few.
Can we? No, it's all set up. Yeah. Let's see. Should we do that? You think we're gonna try? As long as you don't disturb another person's symbol by taking them out, that's all. Yeah, just don't touch their symbol.
Can you,
I'm going to participate.
just for,
Oh, sure.
it's for, the audio is on as well. Here. I'll be right back down.
Okay. Someone can I get him back there, please? Yeah.
And the best way to view your tray is from this angle, because this is how you project out to the world. Yes, definitely. Yeah. You can lift up your symbol and reshape the environment. That's fine. Thank you. Well, you cannot remove another person's symbol. You can connect to that symbol. Unless you can go in proximity, on top, or next to it.
That was my next question.
Yeah. And also for, I forgot the lingo. I am not doing any interpretation. Okay?
If you want to just keep that hand steady, these tensions. Stayed, but it's only on 2 points that have stayed. No? Yeah, maybe put it on a table. Yeah, go ahead. It's not that heavy. You keep on the table right behind it. Or turn it sideways. This way. It's reversed. It's reversed, yeah. Maybe I should put it on top of this. What do you think? Get a more perspective down on it? Yeah. Good. Perfect. Get back.
Also, I want to mention too, sometimes our literal interpretation, when I say do not remove people's symbol, if it accidentally knock off, to reconstruct, it's no harm done. Okay.
That's a good one. Oh. Okay, now you've changed the picture for me now. Okay.
Also in the sand, underneath is blue, okay? So if you want any form that represents symbol of water, you just remove them, then you get water underneath, okay? So I forgot to tell you that symbol.
No harm done.
No harm done. Yeah. Ask the person, or you put it where it's who's the
Rhyme.
Okay.
Who's the
would you
lovely
please
plume?
would you be able to put it where you originally put it, or wherever you want to put it now? Yeah. Yeah.
Sorry.
We keep this a dry tray, otherwise we could have pour water in it to make it easier to, but let's not do it. We can use our imagination, okay?
That's why I don't have a wet here.
And I can do nothing.
You know,
It's a negative projection. That was a little bit slow.
25 after. 25 after. Okay. Calling once. Calling. All right.
I just realized I'm not. There we go.
Calling once. Calling twice. Last chance.
Sold.
So we'll leave the picture the way it is. Now it formalizes a picture. Okay. Picture tells us a collective symbol or individual story. And they say the view go by the century part is from the front. Okay, from the front. You might get other objective view from the peripheral or also from the side. So take turn to see from the front and also from your surroundings. So if you, after you see from the front, you can go around and take a look at different angles.
I'm just actually going to turn it because even upstairs so we can see it the right way.
You think person.
Oh.
And that is called a boundary violation.
And that you only deal with someone that you're really close with.
Bad IT guy.
I know, I might be small and maybe a lot too much. I even say to myself.
Very cool. Yeah.
It's okay, you can walk in front of it, it's fine.
See from every angle. You're just.
I'm trying to see positive over here.
This is, you do that.
Open powers. Okay.
Yeah, don't even switch to my
Sounds
like Steve.
Okay, once you have, is any more viewing? Okay, then may I have the audience over to that side there? And, yeah, right. Yeah, please, thank you. Okay, do this one. I can switch it up. Okay, yeah. Okay. As I say, when you look at the collective composition here, there might be a story you have in mind. Okay, and there might be also you might feel something particularly when you see another person move their symbol and that totally change your story or your own assumption of what the larger story might be. Okay, so given all those, and there's also might be something in the unconscious that we might not know at this moment while we're watching other people put things on or while we were doing it. But at this moment in your conscious level, think about some adjectives. From this morning till now, through those lectures, those discussions, the interaction that you have with your colleagues here, and also the process the little process we did with the century, voice out a couple adjectives and then Raja's going to put onto the board here.
Generous.
Eclectic. Eclectic. Generous, eclectic.
Collaborative.
Sorry, I heard kind.
Calming.
Calming, a calming. And then collaborative.
Individual.
Individual.
Surprising.
Surprising. Individual surprising. Anything that just come up, popped up in your mind.
Painful.
Painful. Exciting. Exciting.
Creative. Powerful.
Creative and powerful.
Interesting.
Interesting.
Harmonized.
Harmonize.
Respectful.
Respectful.
Was it your?
Togetherness.
Connectedness.
Confusing. Confusing. Questioning. Questioning.
Judgmental.
Judgmental.
Accepting. Asian smack.
What do you remember in this whole course?
I certainly remember it.
Okay, let's give it three more. Three more adjectives that just popped up.
Fun.
Two more.
Playful.
Relaxing.
Nobody talk about self. Oh, let's put it down. Self.
Individual, yeah.
Individual.
But self is different.
Can be. Yeah, let's put self there.
Disturbing.
Yeah,
Right.
yeah. If it's symmetrically, I can have four more. Flexible, I can also end flexible. So, yeah. Calling once.
Flexible is there.
Oh.
Peaceful.
Humorous. Reflective.
I really want to be symmetric for the whole thing.
Exactly.
No, I think we're done.
Right. Possibilities.
Oh, no,
Put it in the
no,
middle.
yeah, symmetry.
No. Ongoing, continuous.
Yeah.
I just trying to balance it.
Continuous, is that the word?
Yeah.
Sorry? Is that the word?
Fluid?
You mean
Evolving.
do you mean dot to be continued?
Evolving.
Constant change.
Yeah.
Evolving?
Yeah. I like it.
Thank you. General consensus.
That was more feeling than a word, I guess.
Okay. Okay. I'm gonna do judgment call. Could we just skip this for a moment here? Now, a short phrase. A short phrase that just popped in your mind. You don't have to be grammatically correct. It's just a phrase. whatever the phrase may be.
About
Let's do
the-
it again.
About the event or any phrase.
From 9
Like I-
o'clock,
Oh.
till now.
Oh, about the event.
Yeah, that's right. From 9 o'clock till now, it can be at any specific area this morning. Talk about transference, countertransference, projective, and everything encompassed during today.
There's
And
one. Let's do it again.
Let's do it again. And the person who offered the phrase, they might be a particular moment they focus, and let's just leave the assumption away which moment they are addressing.
I would go with that. That's kind of where I think, I need more.
This is really good for me.
I am so glad you're doing this driving.
Coping with ambiguity.
Coping with ambiguity.
How to deal with difficult people.
How to deal with difficult people.
I just realized something.
You just realize something.
I just realized something.
I just realized something.
Wanting more clarity.
Wanting more clarity. Wanting more clarity.
I say desire for more.
Desire for more.
Appreciating the work.
Appreciating the work.
I love my job.
I love my job.
What was that? I love my job.
That's good. You see it more
just in
and
case
more
it
often.
Should I say the Oreo?
The essence of connection.
The essence of connection.
Sense of belonging.
Sense of belonging.
Knowing my limitations. Knowing my limitations.
Knowing my limitation.
I love counselors.
Can you repeat the question for what answer that was asked?
Oh.
Just repeat for the camera.
Yeah, what we're doing.
What we're doing,
What
not
we're doing.
question.
Yeah.
Okay. Yeah.
I love counselors.
I love counselors.
Yeah.
We simply ask. We ask the participant to give a phrase, whatever popped up from the mind regarding this morning to now.
Events.
Are you going to say a question for the previous sheet also?
I'm sorry?
There's a previous.
Oh, the adjectives. You want to repeat for the previous adjective? Okay.
Jeff,
Value.
It was meant to short-term comic relief. So let's come back here.
Offering you a ping pong paddle.
Where is the fog?
We have room for 3 more.
Oh my gosh. Give peace a chance.
Yeah. There's a song, isn't it?
Yeah.
Give peace a chance.
Oh, we are seeing.
Connecting with the
I guess connecting with the meaning of why I do what I do.
Yeah.
Connecting
Connecting
more
with
about
the
me.
meaning.
Where am I coming from? Yeah.
You change
Of why I do
Okay,
what
finalize it. Let's finalize it. Connecting with the meaning
of why I do what I do.
of why I do what I do. Okay, connecting with the meaning of why I do with what I do.
What I do. Loving the
Oh, with what I do? With what I do.
I do what I do.
Why I do what I do, or why I do with what I do?
No, take out the way.
Well, that's hers. That's hers. That's hers. Yeah.
Sorry. It sounds like what syllable? First syllable?
Connecting with the meaning of why I do with what I do.
Or with
Oh, never thought about that one. It was but that's good.
You taking it? Okay.
You take it? Okay.
Yeah. Okay, that's yours. All right.
Please show for the world.
Fine.
Yeah.
I like that.
Yeah. Yeah. Okay. A lot of times there is an experience or something that is, say, the unconscious may not be that silent. They might come out in terms of a sound, okay? And sometimes the internal sound, we can hear it. And being a human, we can actually hear concrete sound. We cannot go into the unconscious there and really hear the different realm. So just looking at these phrases here, if there's a particular sound that come out from within, feel free to express that. And I will use my imaginary recording to lock it, because she cannot write it down. However, I do offer one opportunity. I'm going to read this because all yours, you will know all these. May I have that? Yeah. When you hear that sound, okay, if you felt I could connect it with a shape, by all means, draw the shape of that sound. Okay. That sound can be a rhythm, can be just simply a sound. Okay.
Like we're gonna do a sound?
Yeah.
Like that?
Yes, if that is what it is. Yeah. From the whole day, and then you have done the adjectives, and then you have done a phrase describing your experience of the day. Let's give the sound. And it does not have to be a single sound. Please do not sing me 5-minute song or American Pie 8 minutes long. Not today.
I'll leave her alone. That's where she goes.
I can make a sound for what we are.
Okay.
I am a soul. So the word for it is, and it's resonated as. You want me to do it?
Yeah.
Okay.
Thank you. Really provide explanation for her sound. Thank you. For others, it's not necessary for you. If you want to just simply express a sound, you have a choice of providing explanation of it or not. Okay. Now, anybody have an impulse of sketching the sound?
That's cool.
Could you provide the sound?
Okay.
Yeah.
Oh, you have to do it every time? Okay.
Just this one more.
Okay.
Would you be able to do the sound one more time?
Yeah.
Okay, before you do that, would someone have the impulse to actually shape that sound? That use your body to shape that sound? If that impulse is there, the floor is yours.
Is
that the shape of me?
I know.
I can do that. If nobody is forthcoming, then I'll go with the gesture here, and I will talk to it also. In one of the yogas, which is yoga, the left is about the past, the right is about the future. Balance in all three, so we can live in the present. Most of our work about our clients or us, people who sit before us, as being in the past or worried about the future. And it also goes in the cycle of fear, doubt, and worry. So when we bring it together, and I'm not going to say because I really have very bad moments. Okay, here we go.
Lisa, can you stay there? Can you just hold your position too? Okay. To close, just stay where you are. Do not move where you are. I'm going to move this away, okay? She just started a part of a sculpture. So also if you feel, okay, you want to add to this sculpture, by all means, then add to it. So it become a picture. Let's go to the body sculpture. Do not hurt yourself, okay? Self-care. And may I create a no-fly zone so that we're definite.
Okay, well, something there. Okay,
Great,
I can
yeah, so
I
it's
can
a little bit of
as well.
a stage room.
Working together. It's okay.
And you can relax too and put it down and put it back up, okay? Adding to it. Remember, this is your adding to it. Okay? It's not other people's picture, it's your own, okay? Yeah. Yeah. You need to stretch, you can do that too. Yeah. And for people who are doing the shape, if you have the impulse to change the shape, by all means. I'm going to finish, you see me come over, and then when I tap you, okay, just make a sound or say a word, whatever comes out, okay? Do not use your cognitive. Just let it come. You don't know where I'm going to tap you. Ready. Ready. Mindful. Mindful. Balance. Balance. Kindness. Kindness. Essence.
Present.
Presence.
Togetherness.
Togetherness. Okay. If you need to relax, relax. Someone have to
just impulsively say a title of this picture.
Zen.
Zen.
No, Zen.
Z-E-N.
Spirituality.
Spirituality. Calm.
Peaceful.
Peaceful.
Unity.
Unity.
Mother Earth.
Mother Earth. Okay, relax, please. We are not going to process this. However, you have opportunity to do some processing work on your own, is to do the self-reflective one, okay, and then also to draw the picture the earlier that Dr. Wong suggested. Okay.
I have crayons, color pencils, do whatever you need to do. We have 10 minutes.
Okay, so you can do that. Another thing is to how when your symbol, when somebody come in here, how does it affect your soul? Those are the ones that might bring up some disturbance. Okay. Think about how would that relate to in terms of your work. Okay, when that is the path to go, and yet the prize, which we saw that word up there. Right? So that reflective sheet there, I believe, have places for you to put something there. So there's 10 minutes left, right, Dr. Wong? 10 minutes left.
Almost 15.
Almost 15. What do you mean almost 15?
Okay, 13 minutes.
Oh, 13 minutes. Oh, okay. So
between 10 and 15.
Okay. So the choices is, oh, I thought we're done. We just we're past something, right? I'm sorry. Okay. Since we have 13 precious minutes here.
12 and a half.
Anyhow, we can briefly, in those minutes, talk about what your response was, your experience with the symbol putting into a sanctuary. And remind there's about over 14 of you here, so it can't go over a minute. Yeah.
So now you want us to do that, or did you want
It's up to you. I'm asking a consensus. If we want to talk about your process there, then we can do it, or you can go ahead and do your drawing.
I think the center.
I think it would take me longer to think and reflect for that kind of activity, but maybe not.
You can take all that drawing home and then you could bring it back next time.
Okay.
Yeah. But with that, what I noticed was I found out that somebody had put theirs close to mine, and I liked it. So I kept going back to see if that changed, because I wouldn't move mine unless that little thing next to mine came with me. So it was like, why am I so stuck on this? Just move it. I was like, no, I'm going to leave it where it is. You know, I just couldn't move it without that coming with me. You know, it wasn't even my piece. So then so I kept going back and seeing what's changed. I had a need to know. You know?
Thank you. With my symbol, I have perfect vision of like a star, in the universe. Then somebody just complete my vision, not yet. Put the scorpion in, which it's the symbol of the zodiac. Then I saw the horse. I was like, perfect. My universe is just almost complete. Then somebody took the scorpion out. Steve, overpower me, jumping on my star and just staying there. So my vision is just this level. Oh.
Yeah, the universe.
Honestly,
Really?
okay. That was the universe.
Just wish
she could mind read you.
Feel like the weight of the
Yeah,
world
yeah,
on your
just
shoulders.
wish she could
You
mind
should
read
read
you.
my mind.
Sorry.
So I was okay. I'm pretty easygoing for the most part, generally. So, people are going, like, oh, maybe I should look. It doesn't really matter. Then I seen this figure that had like a cross. It reminded me of a tombstone. I was like, ooh, maybe I should move that because I'm kind of superstitious. But then as I had that feeling, you said go around the table. And then as I was going around the table, I didn't get that feeling. So I just left it.
And I was trying to figure out, why would you put that there? I needed to try and make sense of what I was looking at to come away with some kind of meaning.
Mm-hmm.
Otherwise, it was just a jumble. So I spent a lot of time kind of going, why would you put that there? What does this mean? It's interesting that I didn't automatically just say, well, it is what it is.
I did that too, and I was happy when Holly moved away over by the water.
Were you?
Yeah.
Well, the thing of it was the
You had it
wagon.
up in the corner
I
first.
put the hill in the corner with the wagon on it because I thought, well, I'm at a point in my life where I've pulled kind of a load, right? And now I want it kind of coming downhill because that's easier, right? So I'm at a point in my life where
So that's what that was
So I was doing all this, like, overthinking and whatever, and then I went over and I went, man, Miss Piggy's in the sandbox. I love the Muppets. So I totally disregarded all of my deep thinking and attached it to Miss Piggy just because I think the Muppets are
Somebody to pull along.
That's right, yeah, I thought, she's strong enough to pull the
I'm sure that the person with that little thing next to mine didn't realize how much that was influencing my next move. They just went, yeah.
That little thing that you left mine?
Well, the feather thing, I coveted the feather thing.
I was
looking for a way to bring that. I coveted that.
I was wondering why you were going close up to the feather.
I was trying to strategize, but my thing was, whoever put that there probably didn't even think how this would be influencing me. I think we do that, don't we? We go through life not realizing that an innocent or glib thing has really a profound effect on each other.
And just how we can flip, like, okay, so the on the hill when I was kind of doing all of my thinking was the adult me, but as soon as I seen the Muppets, that it was like, oh, the child me, right? It's like, screw the adult.
Go play.
And go and hook on to my, childish stuff, which, Miss Piggy in the Sandbox, it's the Muppets, right? But yeah, it's interesting.
It's so interesting because I had Miss Piggy, and I made my modification early before you had mentioned you can connect and change and put things together as long as you don't move other people.
Yeah.
And so I'm watching all of these people she put the horse down over the fence and all of this stuff, and I was feeling very alone. I was like, why didn't I think to connect with somebody or touch something else? I was feeling very alone. So when Holly moved her wagon, it brought this huge sense of I'm actually not alone, and somebody connected to me, and okay, I feel I'm okay now, and I feel more part of the group. So it was interesting that for you something was so childlike, accessing and playful, and for me it was
I went into your adult space, and I went into the child space.
Yeah.
Because I moved it.
Yeah. So it's just very interesting how that I don't know how I responded to that movement.
Yeah.
Of something.
Psychodynamic.
That's what I about us doing this exercise is that it makes sense to us. But I was wondering if I brought in an IT person or accountant. We're all like, yes.
And that's why
My job is to help those people.
They need secretaries. And that's why my comment was, I love counselors, because there's no way, I love counselors because only we can sit in a room and go, yeah. Wow. So your wagon was a what? Wow.
IT people get snapped.
Just springboard on that.
He's probably looking at us going you guys are really loopy.
If this room is full of IT people, or this room is full of
totally different occupation. Are these words specifically just for counselors?
No, the words look normal.
I understand, but those are the adjectives come up from our day experience.
Yeah.
But that means these
Interesting.
can also be the adjectives come up from a totally different.
That's a really good point, Teresa. That's really insightful. Yeah.
And I think that the perspective, if we take that, you know, engineers or accountants, taking that world view, would they use those words, or would the words be different? Because I think we're all, you know, self-referential. I only see through my eyes.
We have an IT guy here. Let's ask him.
Well,
I put it
this is
down
what
on
we
the
do. Is
I don't want to get hit again.
I understand, but there's also another thing earlier you talked about the timing when we interpretate, and in general, a lot of times even research is go by how can you generalize it to the general population. Any of these words, when you look at individually, even collaboratively, if I mix it, okay, it can go beyond this room. Yeah, and even these phrases, okay, some are more specific because now they become, other than single word, it's more meaningful now. Okay? Then we come to story, even more specific. Just have that thought. Yeah. Another thing I want to finish with that is there's different adventures here. There are some surprises, and there's some surprises. Yeah. Regardless, in that terms, how we experience this particular activities. Okay. I didn't see anybody object these words. Some of them might and might not fit you, but you see the majority of the words are fitting.
Yeah.
Okay? Yeah. So that means that whatever that might be, we feel a little disturbing part of it, let it sit, sleep over it, and see what kind of discovery you have, and we have next week.
Awesome.
Yeah. Okay. Now the ball will be back to Dr. Wong.
Good job, Teresa.
Very good.
Excellent. Now the time is exactly 4 o'clock.
Wow, we're efficient.
Isn't
We're
that
efficient like IT
beautiful?
people.
And no one's running to get out.
No.
I mean, that's the amazing bit.
They have closed the door, so I noticed the door.
That is a mess. Well, we'll say goodbye to our webcam partners. And we
Thank
wish
you.
you are here and to participate in this warm, accepting comfort in the
Fun and
basement of
playful.
our home. Yes, and we will continue to be playful, to be honest, and to learn and to grow.
Awesome.
And have a wonderful week. And we will see you back on Saturday. And if you need anything, send me an email. Take my card. It's got the white horse on it. Okay? And anything that you wanted to have more or whatever, we will try to respond.
Why did you pick a horse and a white horse?
It was really funny because when I was speaking in Tokyo, and they say, your card has a white horse that's sacred in our culture. And I said, oh, I hope I didn't. But I ride and I jump. Not higher than 3 feet.
Yeah, but on a horse?
On a horse. Details. What happened is, most of the picture of horses, what do you see? The side view of the head of the horse, or the horse galloping.
Right.
But I wanted to find it, I wanted to feel that horses are just as intelligent as dogs. And horses are very generous. They allow you to sit on their back and they listen to you. Because the back is very sensitive. Now, I don't do the Western yeehaw kind of thing.
Like this guy over here.
Because you write English, and Their back is very sensitive. The bits are very sensitive. They don't even need to be whipped. As soon as the corner of their eye see the whip, they right away will do whatever they want. And then when you pull your thing, you don't pull it, yes, like this. You pull it with your body so that they feel they are part.
All right, that wraps things up for today. Thanks a lot for joining, and I will be in touch with those of you who asked questions that haven't been answered yet, and we'll get you some answers by email. Thanks.